Over.
Hello, everybody.
Good morning, and wow, what a show we have in store for you today. There was just, yesterday. Wow.
Yesterday, today, tomorrow, next week.
Yeah, rapidly evolving. Things are just changing on the daily basis. But the core of everything is our battle to contain the COVID-19. That's, I think, the most important thing that's going on, and we're not doing that.
Yeah.
We're not. Sabrina Salas-Matsanani, I'm Chris Barnett, by the way. The phone number is 637-0094. Good morning to our Facebook live viewers all around the world. I hope you guys are doing good, sheltering in place, washing your hands, wash your fat while you're at it. And, so there's just so many developments with Teddy Roosevelt, and this is something that is really taking center stage on a lot of the national media outlets. So we're going to have a lot on that this morning. Of course, the latest numbers, not promising at all.
No. The latest results were released by the Joint Information Center at around 9:40 last night. Public Health tested 41 individuals. 6 tested positive and 35 tested negative. The overall count also includes 6 positive cases that were tested by the Naval Health Research Center in San Diego. So the total number of confirmed cases on Guam is now at 77. Just like that, right?
So 3 deaths, and then Saipan as well as seen a spike in the cases.
Yes. Public Health also just an announcement from Public Health that they've opened a primary care facility in Barrigada Heights. Nurses and doctors are available to evaluate patients and collect specimens if necessary. Public Health Center is located on South Savannah Barrigada Drive. To get to the center, the community is advised to take the south entrance to Barrigada Heights next to the commercial tire depot and drive to the top of the hill of the residential area until the road ends. The Public Health Central Health Clinic Center is a large complex on the right side. It operates Monday through Saturday, 8 a.m. to 6 p.m. And there's a phone number at 638-4513.
Yeah, I saw that, and that's kind of big. And so basically what they're doing is trying to create a new place where people can go and be seen. And, sounds like they're going to be testing people.
Yeah, I don't know, but...
That's the information that we got at 6:12. So a big press conference with Governor yesterday.
Right, yeah. But let me just go into some of the national headlines first. The White House Coronavirus Task Force is now warning the worst is yet to come in the fight against this pandemic. This is the president. He said that this could be a hell of a bad 2 weeks. The president says extending social distancing guidelines for the next 30 days is a matter of life and death. But even with restrictions in place, modeling shows 100 to 200,000 people could still die in the United States. Dr. Anthony Fauci saying we don't accept that number, that's what's going to be. We're going to be doing everything we can to get it even significantly below that. One possible new measure could be asking Americans to wear masks once the supply increase. The U.S. Surgeon General, Dr. Jerome Adams, said we asked the CDC to take another look at whether having more people wear masks will prevent transmission of the disease to other people. But here's the most important thing. Even if you do wear a mask, it can be at the expense of social distancing. While most states have issued stay-at-home orders, there's still no plan for a national mandate. As for the U.S. Navy and the USS Theodore Roosevelt, the Navy is pulling sailors off the USS Theodore Roosevelt, which was an aircraft carrier hit hard by the coronavirus and forced to port into Guam last week, Friday. Almost 1,000 sailors are already ashore, and at least 2,700 sailors, more than half of the crew, will be taken off the ship within the next couple of days. And that was from a press conference that was held earlier today by the acting Secretary of the Navy, Thomas Modly. But here is Governor Lulian Guerrero and Rear Admiral John Manoni when they finally addressed the public on this issue during their media briefing yesterday.
Earlier this morning, I I spoke to Admiral Minoni and Admiral Aquilini. Earlier this morning, I spoke to Admiral Minoni and Admiral Aquilino regarding the letter from Navy Captain Brett Grozier of the USS Theodore Roosevelt. Throughout our response to COVID-19, I promised each of you that I would undertake any action necessary to keep the people of Guam safe. For this reason, I have agreed to allow the restricted housing of sailors who have tested negative for COVID-19. In partnership with the Guam Hotel and Restaurant Association, public health officials, and representatives of the Navy, only sailors testing negative for COVID-19 will be housed in the vacant Guam Hotel rooms, subject to a 14-day quarantine period enforceable under the Uniform Code of Military Justice. Because I did not make this decision lightly, other conditions must be met as well. There will be daily medical checkups of all sailors. Military security will be on every floor and at all points of entry. Individuals will be subject to quarantine protocols. Our beaches are off limits, and PPEs will be provided by the military to any hotel worker who is a part of this operation. We have an interest in protecting our community and stopping the spread of COVID-19 just as much as the military has an obligation to return the USS Roosevelt to the open ocean to protect Guam and the region. I know there will be a small chorus of cynics who will oppose this decision, but now is not the time for us versus them. While there are sailors on board that ship from every corner of the nation, some of those sailors call Guam home. They sat at King's with friends on a Friday night. They graduated from places like Simon Sanchez and George Washington. They are our nieces, our nephews, our sons, our daughters, and grandsons and granddaughters. And we can protect Guam while being humane to them. That is the Guam I know, and we will not abandon who we are out of fear. Every decision we make during this pandemic is made and will continue to be made with the health and safety of our people in mind. You entrusted me to lead this office for the good of our island, and as your governor, it is a responsibility I do not take lightly.
Thank you, Governor Leon Guerrero, for inviting me here today. First, I would like to thank you and your staff publicly for the leadership, collaboration, communication, and coordination that you've shown throughout this crisis. You know, when we first became aware of COVID-19 and its start and march across the globe, you immediately and your staff immediately contacted Joint Region Marianas to coordinate our efforts, and I truly do appreciate that. To the people of Guam, first off, I want to say thanks. Not only has your support been unwavering since all my years on Guam, but during this time of crisis, you have fully been behind the United States Navy, the Air Force, our partners in the Guam Guard, and the Army Reserves. We truly appreciate all your efforts. To the people within the fence lines on the military bases, I've asked a lot of you the last few weeks as we've worked to protect Guam, both inside and outside our bases, from the spread of COVID-19, as well as to support our shipmates and sailors on the USS Harry S. Truman, the USS Theodore Roosevelt, and the other ships in port. You've been asked to sacrifice, you've been asked to work long hours. I truly appreciate your efforts. There's no higher calling than taking care of our shipmates and families. To the folks that are outside the fence line, once again, thank you so much for your help. Thank you for your prayers. And I really, truly appreciate the outpouring of support that we've seen for the sailors of the USS Theodore Roosevelt. Thank you.
The question is, the captain of the Teddy Roosevelt had recommended removal of all but 10% of the crew. Is that the plan at this particular point in time?
So the plan at this time is to remove as many people off the Teddy Roosevelt as we can, understanding that we have to leave a certain amount of folks on board to do normal watch standing duties to keep the ship running. That doesn't mean that all of those people will be brought out into hotels within the local community. It means that we'll work with the government of Guam, the Hotel Restaurant Association, and then within our fence lines to appropriately house all of those sailors within CDC guidelines.
And how many, Admiral, will there be at a time transported down to Tumon?
Yep. We're developing that plan right now, but it's going to be in manageable groups, and they'll be transported and controlled by military personnel only.
Admiral Aquilino had mentioned a Marine contingent of medical personnel. Can you elaborate on that?
So we will have approximately 40 professionals from the 3rd Marine Expeditionary Force Medical Battalion arriving on island within the next 24 to 48 hours. Those folks are not only here to help the sailors on Theodore Roosevelt, but also to help build capacity at Naval Hospital and then backstop capacity within Gov Guam.
What reassurances would you give to the people of Guam that transferring these sailors from Naval Base Guam to Tumon does not pose a threat to them?
So the biggest reassurance that I can give you is that all of these sailors that are transported off Naval Base Guam out of their quarantine areas and into Tumon will have a negative COVID test. No one is allowed off the base unless they've been tested negative for COVID-19. The second reassurance that I can give you is that these sailors will be under the direct supervision of U.S. naval personnel, both potentially naval security forces, Marine security forces, and then potentially local security forces to ensure that they comply with the mandatory 14-day quarantine period.
Concern about potential exposure, and as much as we can anticipate it, we are addressing it. I know that with the hotel workers, I believe the military and that they can speak to it, but they're going to have their own resources also at the hotels, and we will minimize the contact of these hotel workers to almost no contact. They're not going to be going in to change the linens. They're not going to be, working in direct contact with these individuals. My understanding is that the military is going to set up a process that is going to make sure that there is no contact. So I don't know if the Admiral will want to add in some of that.
So there's a strict, no touch, no contact policy at this time. Out of an abundance of caution, even though these sailors have tested negative, we're going to put in a buffer of local sailors and Marines that are going to essentially be the forward-facing element of the hotels. So the staff will be working in the background, running the hotel. Any interactions with the sailors that are housed in these hotels will be appropriate in accordance with CDC guidelines, but it'll be military to military and not military sailors.
Commander of Joint Region Marianas and Governor Lulian Guerrero giving details and finally announcing to the public here on Guam, at least, what was happening with the Theodore Roosevelt sailors. So overnight, early this morning, a press conference was held, I believe in the nation's capital, where Acting Secretary of the Navy Thomas Modly gave even more information about the movement of the sailors.
To get the crew what it needs in this time. As you heard from Admiral Aquilino, the PAC Fleet Commander, yesterday, the situation is very dynamic, and we are supporting our subordinate commanders to ensure we protect our sailors and our Marines so that they can protect the homeland and maintain their readiness to the best of our ability. I recognize that there have been a lot of questions about the Teddy Roosevelt, particularly over the last 24 hours. So I gave some updates yesterday when I was out in California, but here's the timeline of some of the actions that we've taken with the Teddy Roosevelt since she deployed. Prior to deployment, we embarked a special medical team on the ship, and prior to the post visit in Vietnam, the World Health Organization had identified less than 20 COVID-19 cases in Vietnam at the time, and all of them were in Hanoi, pretty far away from where the ship was going in Da Nang. And they had seen no recent new cases before the ship pulled in. We conducted screening for sailors returning from Liberty, including temperature readings, And anyone who we may have suspected having been exposed was quarantined immediately, and we had no positive tests at that time. At the end of the 14-day observation period aboard the ship, there were 2 sailors with symptoms who had positive tests. They were promptly isolated and flown off the ship to Guam, to the hospital there, the Naval Hospital in Guam. Their symptoms have since resolved. We identified and quarantined all those who we suspected of being in close contact with those that had tested positive. When the TR pulled into port, all sailors with confirmed positive tests were moved off the ship and isolated immediately. We continued contact tracing, quarantine, and monitoring to fulfill the process of understanding who might have been infected, and we did that in a very methodical way based on who we thought may have had contact with the sailors who tested positive. On Sunday evening, after being in port for a couple of days, the commanding officer expressed concern that the spaces off the ship were not sufficient to isolate at the pace that he felt was necessary. We also received some feedback from the medical team that they were concerned about the same problems in terms of not having enough space off the ship. Let me emphasize that this is exactly what we want our commanding officers, our medical teams to do. We need a lot of transparency in this process, and we want that information to flow up through the chain of command, and that's what they did, and we appreciate their ability to let us know at our highest levels where we can apply resources to help the situation immediately. We began seeking additional space in Guam and elsewhere right away. We're making progress on that process. We already have nearly 1,000 personnel off the ship right now. And in the next couple of days, we expect to have about 2,700 of them off the ship. One thing I want to emphasize as well is that we cannot and will not remove all the sailors from the ship. And that's not what the commanding officer requested either, nor the medical team. Our plan has always been to remove as much of the crew as we can while maintaining for the ship's safety. It's important to understand that just because it's big and it floats and it has a lot of people on it, the comparison of the TR to a cruise ship pretty much ends there. This ship has weapons on it, it has munitions on it, it has expensive aircraft, and it has a nuclear power plant. It requires a certain number of people on that ship to maintain the safety and security of the ship. There are less than 100 personnel who have tested positive so far. None of them are seriously ill, and not one of them has been hospitalized to date. Currently, the numbers are, we have 93 positive tests, 86 exhibiting symptoms and 7 without symptoms, 593 negative tests. And we've tested about 24% of the crew. And so we've got 1,273 of the crew that have been tested. Some of those results have not come back yet. We have accelerated testing and are deep cleaning all the spaces on the ship. We are providing the commanding officer what he has requested, and we are doing our best to accelerate the pace wherever we can. Like the rest of the country and the world, we are learning more about stopping the spread of this virus each day. The front lines are constantly being redrawn in this process. Stopping the spread of this virus is the fight we are in right now. Right now, the Teddy Roosevelt is a frontline theater in this new battle, and we have to respond with the skill and agility and direct communication required to protect our people and our nation. I'm confident that the Navy and Marine Corps team will save lives and protect this nation as it always has and it always will. So thank you, and I look forward to your questions.
All right, Lita Baldor, AP.
Hi, thank you. Good afternoon. You gave us a good update on the numbers. I'm wondering if you could talk to us a little bit about where the sailors are going. And you mentioned Guam and other places. Are there plans, or is there the need to take the sailors to somewhere other than Guam? And do you have enough hospital rooms that you think you'll be able to accommodate everyone? My second part of the question is, there's been a lot of discussion from the Admiral about this rotation of sailors offshore to make sure that they're okay and then back onto the ship. In doing that, about how long do you think the ship will have to be in port in Guam? It sounds like that will be at least several weeks to a month anyway. Thank you.
So let me answer the first question. I may have misspoke. We're still only looking at locations on Guam right now for the sailors that we need to take off. What we are looking at is beyond just the facilities that the Navy has, or space or real estate that the Navy has, or the DOD has on Guam. So we are in conversations with the governor of Guam to see if there's an ability to free up some hotel space, and they're working that one pretty diligently right now. It looks like that is going to be one of the areas that we can send people to. As far as how long this is going to take, I don't have a good estimate on that. I will tell you it won't be resolved in the next couple days. It will take some time, but we're still looking at that and trying to get a good understanding of what that might impact with respect to operational readiness. I would also like to emphasize that if the ship needs to go, if there's a crisis, the ship can go. That's part of the reason why we're maintaining the skills on the ship that we need if we have to move it in the case of an emergency. So I don't know if CNO wants to add anything more to that, but with respect to the operational considerations.
So I think in terms of numbers, so I think you mentioned, Mr. Secretary, we have over 1,000 off the ship right now. We'll have nearly triple that number of beds and spaces available by Friday, and we'll be expediting. People are moving off the ship as we're briefing right now. In terms of the operational schedule, I'll just tell you that in terms of testing, we continue to get more efficient, and so over the past 2 days, we've gone from 300 tests up to 500 tests. And so the long pole in the tent, of course, is getting those testing results back as we get those samples to a DoD facility for processing. And I don't want to talk about the operational schedule of the ship at this moment.
Jennifer, we'll go to you next.
When we asked about this last week, you said that you had no evidence that it was the port visit to Vietnam. Have you changed your assessment in light of the exponentially rising numbers? And was it the letter from the captain that caused you to start to move faster to remove people from the ship? And is the captain going to be punished for having raised this in very stark terms?
I'll take a shot at the first several questions, and I'll turn it over to the CNO. With respect to your first question about, remind me again, I'm sorry. The
port call in
the
Vietnam.
port call. We don't have any forensics that would indicate that was what caused or brought the virus onto the ship. As I mentioned, when the crew came back on the ship, we tested certain members that we thought might have an issue. None of those tests came back positive. So as I said before, we also had crew members flying on and off the ship from the air wing. So we're not really sure where it could have come. Someone could have brought it with them from San Diego when the ship actually deployed. We just don't know. Once the virus gets on a ship like that, it's going to spread, and it's hard to tell where it actually started. With respect to the prompting of the CO, we've been in constant communication with that team. My chief of staff has had conversations with him. I think there were some timing issues related to when that letter was sent, when it finally made its way out into the media. But we've been reacting, obviously, because we want them to tell us what their issues are so we can react to them. So I don't know if you have.
Yeah, it was a risk-informed decision to go into Vietnam. So at the time, there were about 15 or 16 cases there up north in Hanoi, and the ship pulled into Da Nang. Today, there are 203 cases in Vietnam and no deaths. So just to put that in perspective, and the WHO has graded Vietnam very highly across 12 or 13 different categories in terms of their reaction pretty early on and their ability to sustain that. As the Secretary mentioned, the ship deployed in mid-January. So prior to that period, most of the crew and the air wing were off on pre-movement leave. So that would have been over the holiday period. So there could have been asymptomatic cases on board at some point. There was also a port visit to Guam in February when she had been at sea for about a month. So there are other vectors, of course, in which COVID could have been introduced to the ship. Understanding exactly who patient zero is probably going to be an impossible task.
Well, there you go. That's a live feed from the acting Secretary of the Navy, Thomas Modly, and really trying to get you guys the latest information in real time.
Yeah, that actually happened a couple hours ago.
Right, yeah.
And that was also Chief of Naval Operations Admiral Michael Gilday. They told the media that almost 1,000 sailors are already ashore, and at least 2,700 sailors, more than half the crew, will be taken off the ship within the next couple of days.
Let's run through those numbers here.
93 have tested positive, 86 are starting to show symptoms, and 593 tests have turned up negative, with 1,273 have been tested. They're just waiting for the results.
Okay, and let's go outside all around you and get Tamuning, Tumon, Harmon, Mayor Louise Rivera on the line and kind of see if she's seen anything in her neck of the jungle. Good morning, Mayor.
Hi, Mayor.
Hey, good morning, Chris and Bree. Good morning to you all.
Good morning, Guam.
Good morning.
So, Mayor, we hear you're going to be getting some sailors down there in Tumon.
Oh, well, we hear a lot of that. We're seeing canopies put out in front of buildings all over the place, so but we don't know which one it is.
Where are you seeing these canopies?
Just going up in different places, different hotels. So a lot of questions have come to me about if they're going to use this side or that side. And I have not received any official notice or anything about where exactly or which hotel they'll be using.
So which hotels are you seeing the canopies, though?
Of course, there's the ones on Epal Road, and then
that would be
there
Days
was one
Inn
at
and
Sheraton.
go back. I'm sorry, Mayor. Which you said Days Inn and which?
Days Inn, and then like how Windham is where they have we see like officers outside and the cones on the road. I got a call about canopies going up in front of Sheraton, and then just different places. I haven't talked to the property owners yet, but usually I would do that just to make sure. And we continue to ask the Joint Information Center for information. So I want official information before I put anything out.
Sheraton, that's in Tamuning, right? That's in Tamuning.
Yeah.
Okay, so you mentioned Days Inn, Wyndham Garden, Sheraton, and what about in Tumon?
Well, in Tumon, we're hearing about different hotels where guests have been moved to, but I really don't know which ones exactly they'll be using to quarantine or to help out those that are on the ship.
But you've seen tents and canopies in Tumon also? I mean, we already know that Pac Stars, where quarantined passengers from the flights that arrived to Guam have been staying, but if you've seen additional activity in other hotels?
Well, no. Just gearing up of, so I don't know if they're just cleaning or screening their guests before they come inside. But
no, I don't think there's any guests.
Yeah, no, I wouldn't call them guests. I'm pretty sure they don't call themselves guests. Charges, maybe they're the charges. Inmates.
I wanted to follow up on the Hoffaday bingo situation. Have you heard anything else about that? Because
we haven't heard
anything.
anything,
We just
Mayor.
got it from the Joint Information Center a couple weeks ago, and then it was like nothing.
Yeah.
That is correct. I have not received anything either. The latest information we received was about 2 homeless individuals being tested positive. And as you know, we have many homeless people still around the island, all over the place. And, especially with our park area, they're right there in Tamuning. There's several people there. We're always telling them, not to be congregating there because sometimes there's, 5 or more altogether.
Right.
So you were contacted by the Joint Information Center about the 2 homeless people, so they were from Tamuning? I mean, were staying in Tamuning?
No. It was just on the press release.
Okay, yeah. But you don't know if they're in staying in Tamuning.
Yeah, I have not been contacted about, about that. We did our last meeting that we had with Governor's office, and Dr. Cabrera was on Sunday with all the mayors.
Tell us about that meeting, Mayor.
Well, we did the Zoom video chatting, and so our concern is, what are they going to do about the homeless? And they said that they're still working on it, and so we're still waiting for an answer or what we can do or what we can have them go.
So
I wonder, Mayor, if
spaces out there.
I wonder if the canopies that are being set up at any of those hotels, or if that is going to be something for the homeless, because we've got the sailors, but then at the same time, we've been told by the administration that, and also talking to people with the Guam Homeless Coalition, that there is something going on with them trying to create some area where they can house the homeless.
Right, because they need to have places, which the governor said, where they can, shower. So nothing since Sunday? No other?
Well, we have not heard anything, but we've been posing that question, for even before this pandemic crisis.
Did you try calling 311?
No, I have not.
You might want to try that.
I would assume that we would be notified as leaders, and then they also consider us frontline. So to be informed of everything going on, or to even take our suggestions. Yeah, we're just waiting for a response, and we'll continue to follow up with them.
You've been asking, I know you said you had a WhatsApp chat group with the EOC. Yeah, the EOC.
Yes.
And you have a rack there. You still have a rack? That's a response activity coordinator for people who are watching and not sure.
Bree's going deep. She's using the lingo now.
Do you guys still have a rack?
I haven't called to check if we do up there, but I direct all my questions to our Madam President, Melissa Tavares, and our Executive Director, Angel Sablan, or just to our EOC chat group. Okay. And hopefully they give a response, because, I'm pretty sure, all the other mayors feel the same. We need to know.
Right.
We want to know what's going on, and then because yes, we hear that people are being quarantined. I know that some have come right off the plane and are quarantined at home. How do we know they're not going out shopping at Payless or Costellas? What have you? If they need help, I'd like to help them. Now, we have our gloves, we have our masks. So, if they need bread, I'm going to go buy my family bread so I can buy one for them and have it trucked off. We want to help them. We're asking them to help us, give us the information so we can help them too, to stop spreading it, to make sure they're not going out. They understand.
What about when you hear the JIC saying, well, you just have to act like it's everywhere, that everybody is infected?
Well, then why are we still going out, giving out food, to, like having people come and pick up food, at the schools and at the, at the centers. We act like they have it, but, there's others. We don't know if they're the ones carrying, and, it's just too close. Even if they say 6 feet away, but, we're using sticks to pass out the food, or even just, just to go around. We need to know more. We just need to really, be informed. And then, of course, I have people calling me about, like, those that are deceased. We have friends and family in the community and all around that have passed away, and we don't know if they passed from COVID-19 or, unless the family tells us. But, we just need to be more informed. They have that information, but at least to, to share it with those, especially those that understand confidentiality, and HIPAA, all those regulations. But,
has anybody in the community told you that their family members passed away from COVID from your village?
Not from my village. Okay. I do have a couple of people that passed away, not of COVID, but I am aware of one, a family friend, of a friend of mine, is a family member, but not from too many.
What village?
I'm not sure. I just know that the kids grew up in Tumani. Yeah, but I don't know where their father stays at.
Well, I just have one more question. And what seems to be the sentiment in the community about this move of the sailors from the USS Theodore Roosevelt into hotels in Tumon or Tamuning or wherever? Do they have any concerns, or they're fine? And acknowledge
Well,
the fact that
we just want to know where it is so that we are more cautious about, which way we're going when we're going to to get groceries or what have you. They just want to be informed so that, that they'll stay away from that area because, they also say it's airborne, so.
Well, I think if you haven't been told that you have any positive patients in your village, or can't even identify isolation facilities or quarantine facilities, you're probably not going to know.
Yeah. Mayor, keep us posted. You're our agent in Tamuning, so keep us posted. We got Mayor Hoffman
our field reporter.
Right. We got Mayor Hoffman on the other line. We're going to catch up with him too. Okay, Mayor.
Okay.
Thanks, Mayor.
Thank
Take
you.
care.
Okay.
You too. God bless you.
Okay.
Wash your hands, Mayor.
Yes, I will.
Okay.
Thank you.
Bye.
There you go. That's Tatuha Mayor Luis Rivera. Let's keep it going with the mayors here. Sin City in the house with Sinania Mayor Robert Hoffman. Morning, Mayor.
Hoffman, good morning. Reporting live from Sinahania, your field reporter.
Central Division.
I always wanted to do that. Central Division. I always wanted to do that.
Oh, Lordy.
Oh, Lordy. Mayor, just... I guess just first of all, we've been hearing all the mayors say that. Like, no mayor that we have talked to since we started this has said, I'm really very well informed, and I really just want to say thank you to the COVID response team for keeping us mayors in the loop and just making sure that we go out there armed with the best information. No mayor has ever said
We're
that.
aggressively able to prepare for.
Right. Which I think mayors, it's just unfortunate because you guys are a great resource out there in the front line of the villages. You know what I mean? The governor's office, public health, they can't go out in the villages like you guys can. They don't know the villages like you guys do. Yeah.
Thank you, and we're trying our best. We had our first, we had a press conference with the physicians group on Sunday.
You had a press conference?
Zoom. We had
Zoom,
whatever. So we had a Zoom conference with them. Well, sorry, not press. So we had a conference with the physicians because we raised our concerns about, getting the issue, getting what we need to know and stuff. And, they keep coming back and saying, well, just treat it like everybody has it. I said, that's the hard part because if everybody has it, it's exactly what Mayor Luis said is that people are still going out and about doing these things. Some people are still going to work. And what kind of raised my concern yesterday is when you saw the JIC announcement, I think it was number 43 something, it said 2 of them are homeless. And so how do you shelter in place homeless? And if they are homeless, are they going to the soup kitchens? Are they going? So that means there's 70 people that eat regularly at night at the Ministry of the Homeless. So do they practice social distancing and other things? Not really. We don't know these things. Yeah. So it is a big concern. And so we just constantly keep asking, please tell us the villages, tell us who, so we can kind of help flatten this curve. But, they seem that they feel they know better.
Yeah, Mayor, I wonder, because, we have asked questions like that, but it seems like, I don't know if they're using it as a caveat to just say, oh, well, everybody has it. That's that. Because it kind of seems like they're just saying, oh, just assume everybody has it, and that's that.
And that's the hard part is that, okay, so if everybody has it, then let us all stop doing our food deliveries. Let's all stop asking people to come around and pick up lunches. Let's stop all going out there and doing the other things that we are continuing to normally do. Because I know tons of people that still go to work and have to go to work. So if they have it, can we just treat it as, hey, I'm not going to go to work because apparently I supposedly have it. So it's really hard to say. So I understand by reducing the numbers of people out there, it reduces the risk, but there's still a risk for it to grow. Yeah. So it is a massive concern for us.
Yeah, and I'm pretty sure they're saying act like everybody has it because of situations like this where you have, people going to Hafa de Bingo. There was a cluster there. We didn't hear about it anymore because I feel like, I don't know who it was. Was it Dr. Cabrera or somebody that we talked to? Maybe it was Linda. Talking about trace investigations, they're basically at a point where they feel like doing trace investigations is almost moot because, like you said, we have two homeless who they went to the soup kitchen. They did this. I mean, we don't know how many people they came into contact with, and I think it was the governor in her press conference maybe 3 days ago where she said that we are discovering new cases faster than we're recovering.
Yes, and that's the thing is, if the homeless, of course, they have no travel history and they got it through community contact, could it have been spread through money? Because, you know, there's cases I've read in reports where they're saying the COVID can stay on money. So could it have been somebody in a car handing them money, and then they take that money, and that's how they came in contact with it? Because, you know, they wouldn't have these kind of close contact. Or it could have been somebody coughing up a storm in their car, and then they rolled down the window and hand them something. So you know, there's so many questions, and I think that's the hard part for us, is trying to get ahead of this and get some answers.
Right, and I think that there are even more questions, because the science on this, it looks like if you kind of Google, you know, like negative COVID-19 test results, or you know, sunlight effect on the coronavirus, you get so many different answers. So it kind of seems like the science and even how it's transmitted. You know, they're talking a lot about fomites, but then you talk to one doctor and it's like, oh, hard surfaces like steel and plastic, the virus can survive for, you know, X amount of time. But then we talked to someone yesterday, and they said, oh, you know, to-go containers, yeah, they can't really survive on those. So there's not really a lot of, it's almost like the information's still developing, you know?
Mm-hmm.
It is, and I was watching CNN this morning, and Dr. Fauci was just saying that, you know, they're discovering that it's not, COVID is not just for people who have other conditions. It's also affecting now people that they're noticing that are healthy people. So they're trying to figure out what is that reactor for them that actually makes them sick. And they're not, you know, they were very healthy and very active, and so it's now raises the new question: are these CDC World Health Organization guidelines correct? And so you're right. It's a science. It's constantly moving. So as they kind of examine more cases, so that's kind of why we're trying to figure out what can we do.
Right.
And you know, you in Saipan, I don't know if you heard, but the youngest positive patient there is 14 years old.
Wow. See, no, I did not hear that. Wow.
Yeah, and I just had my 16-year-old son last week. I mean, they think that only, you know, older people get it.
Yeah.
And so he was like, yeah, but, you know, there haven't really been any teen cases. I haven't really seen any. So, you know, now we got a 14-year-old in Saipan.
Yeah, it is heartbreaking. And as you hear the stories around the world of either, you know, the success stories of the recovery, but you also hear the tragic stories of the loss and of these families, of these people who are fighters, who are doctors, who are, you know, frontline people, the NYPD, you had, you know, all these first responders. So it is hard to fathom of what this is and how this is really going to be, you know, grow in our community, and how it's going to affect our community, and what's going to look like after.
Right. I mean, I'm not even thinking about what it's going to look like. And you know, not even having to go all the way to New York to see these stories of these first responders. The press conference yesterday, Lillian Posadas, they kind of dropped that. How many Guam Memorial Hospital staff?
5 Guam Memorial Hospital staff, and she messaged me last night with the breakdown. And, you know, I know she's busy. She said of the 5 employees, 4 nursing staff and one dietary.
Wow.
That was the breakdown.
Yeah, so
and
I mean,
how does the dietary get in contact with that? That's kind of a hard part, because I know they don't. I don't think they're the ones who deliver the food, unless I think it's the housing aides or whatever their assistants. They're like dietary aides, but hoping it's not somebody in the dietary department, because then
yeah, and then
that's somebody who goes to the whole hospital.
Right. And then when you you know, hear this news that we have 4 GMH staff that tested positive. 5, right? Because there was another one.
No, 5. 4 of them nursing staff, 1 dietary.
Okay, so when you hear that, it kind of really gives more life to these concerns about you know, moving the maternity ward out of the Guam Memorial Hospital, which, you know, last week it sounded like it was a priority. The people who were involved with the process were saying, yeah, we're going on tours, we're doing this, and then it's almost like they threw cold water on it, because now you know, Lillian had said that, hey, that's still in discussion, and now it looks like they are focusing on moving out the elderly patients out of the hospital.
Right, the adult patients. That's the priority, is moving the adult patients out of GMH, and then, you know, the talks are still, nothing's set in stone, to move out the pregnant women.
But I can't imagine the anxiety of these, you know, just people who are at GMH, knowing that we've had a staff that's been, you know, so unfortunate that they're exposed, and you know, they contracted this virus.
That's across the country too.
Yeah.
And it's going to be hard if public health has to do the tracing and tracking of that too, because, you know, how many rooms are in that in the hospital, and what patients was that nurse assigned to, or what person did that, and then it has to grow from there. So
And that's
it
the
is
thing.
difficult.
That's the thing. I mean, I just don't know if public health has that many people to do this many trace investigations, and
Yeah,
so
they
I
don't.
can see why it would help if they spoke with mayors to assist in
Well, we
in all
asked
of
public
this.
health. We told them, I said, use the other agencies, have the other non-essential agencies, workers come in and help them. They can make phone calls, they can do follow-ups, they can do house visits and monitoring and surveillance. But it's something we did ask, and we repeatedly asked on Sunday again when we had our meeting. And we've also brought the issue about the maternity ward. I know Mayor Rivera, that's one of the things she brought up there. So we're hammering at it, and we're asking the questions as well.
I wanted to ask, since you guys don't get the information from the Joint Information Center in terms of what positive patients are in what villages, so what are you doing in the interim to make sure
I
that...
know my residents, the families that do tell me in confidentiality that their family member has it, they do tell me, so I'm aware of who has it here in my community. But that's because the families told me. I don't know if there's more than that many that they have told me, but we're assisting that family as much as we can. And the other day, VIP Restaurant actually donated masks to the mayors, and so that was kind of pretty cool on that end of cleaning supplies. So we thank them because they stepped up. So we divided that out. Yes, it was 195 masks and 500 of the surgical masks, and so we've deployed that out immediately because that's what we're using to deliver these foods. Because
Mayor, who donated that?
VIP
Restaurant.
Okay. Oh, wow. Did they give you any honey walnut shrimp?
I wish. Actually, I'm allergic to shrimp, but I was thinking of salted pepper pork chop.
Right. I'll take it too. Sorry.
So they've been great. So the community is stepping up, and Crystal Paco's arranging to get masks to us from. I guess there's a bunch of really nice community volunteers that are sewing. So at least they're also thinking about us on our end here, and we've had some really nice people just in our different communities drive up and give us boxes of gloves that they found at mini marts or everywhere else. So they, at little stores. So we really appreciate all that they're doing. So they're really our COVID heroes as well, because we're delivering about 1,000 some meals already, and that's a really big task for us, and that's what we spend most of our mid mornings and doing. And so we're usually done delivering by 2:00 in the afternoon. But from 11:30 onward, you have hundreds of people just going through the villages, driving, and that's the thing. If we're not aware of who has this, is that one volunteer who's trying to do the best work being exposed to it? And so we don't know.
Well, I think it's great that Crystal can get you guys masks, but not get you guys information. So, all right.
Wow, jab.
Yeah. Mayor, what about...
You're not the only one frustrated.
No, I agree. No, and that's the thing is that it's taken a while. It's a request we've put in since for a while, and we understand. Give it to the frontliners, give it to the fire department, give it to the hospital to take care of those. Give the stuff that they need at the hospital to take care of what they need. So we're constantly saying just take care of them first, and if you do have extra, think of us because of our exposure to the community, because of what we're doing. Our essential employees that are out there, and I feel bad for them, and our employees are scared. And Mayor McDonald raised it that several of our employees are also on home isolation, and are not home isolation, but they're self-quarantining under the advice of public health, or because they may have potentially been exposed. So some of the staff are actually a lot less, and I feel bad for some of these mayors because they have maintenance people out, they have clerks out, they have administrative people out, and so we're kind of just waiting for this wave of work to come with all these individual assistants and all these requests for verifications as these the stimulus program gets rolled out. So we're saying, let us know ahead of time, and if you're a resident and you're not on a residency form, call us first and verify if you do have a residency record, and then get that information in there, just so you're in the system itself, because we don't want house visits. We don't want you to come to our offices in this case, in this manner, and we don't want people on the road. So just call your mayor's office, check if you're on the record. If you're not, then there's steps. The clerk's going to ask you whether it be your mortgage, copy of your lease, copy of the utility bill to prove you're there, and then copies of the birth certificates or whatever, just so we can create the record, because we see that all the time whenever there's disasters, is people are under the assumption they have a mayor's verification because they're a registered voter. We tell them it's a different list, totally different list. If you've never needed the government whatsoever to prove that your kid's from this village to go to a school, or you need a government ID or anything like that, you would have never needed a mayor's verification. So now we're telling people, get it now while the systems are not as inundated, because once we kind of get the calls, it's going to. I mean, we're still producing the verifications for SNAP and for other assistance, but we know that once this, everybody has to get, if you want this additional funding from the federal government, you need to get a verification. We know we're going to get flooded as mayors with that,
right?
And
right.
You got to go handle hundreds at the end of the day. So we're telling people, call ahead, call now, this morning at 8 o'clock, call your mayor's office, find out if you do have a verification, have them review it with you over the phone, and if it is, then you can be comfortable. But if you don't, we can help create the record.
Mayor, what about part of the big conversation we've been having the last week is rent being due, and people kind of going into that first pay period with a no paycheck. What are you seeing out there in your village in terms of residents who may be reaching out in need of some kind of assistance?
They're asking what programs are there. They're getting, we're getting the calls. We have some people calling and even driving to Gura, even though they're closed, and they see us outside as we prepare the meals and get in, as we mobilize. And they're like, Mayors, do you know where they're going to open? I'm like, I don't know. I can't tell you. I'm not Gura, but and so they're very nervous and they're scared as well to figure out what's going to happen. So I think as long as there's no local legislation preventing it and there's no national kind of word of saying, okay, you can't be evicted, and so they're concerned about either they're going to get late fees or they're going to get they're going to have to pay these penalties, and so they're just trying to figure out, and they don't know if that stimulus whatsoever is going to take 2 weeks, 3 weeks. I hear it's going to take 3 to 4 weeks. Is that going to be enough to cover? So that means they're already going to be a month and a half behind in paying. So we don't know what it's going to do. So it's very I feel for all those people that do have to make those decisions and have to pay those rents. Even the businesses that have to pay rent, it's the difficult thing. They've been shut down for so long. So we're going to see what this is going to do.
Yeah, I was talking to a restaurant we've been picking up lunch at, and they're doing the takeout only. But, it has been slow. And they were just telling me, Chris, we still got to pay rent. The landlord of the place has sent the notice. And so, it puts me in this interesting position because they're like, hey, what do you know? And I'm like, well, I know that they can't evict you, but what are you going to do? Tell your landlord, like, you can't evict me? How's that going to work?
Yeah, so it is difficult. And so the mayors are bringing those concerns. We are airing them. We are sharing them with people that are willing to listen to us on that end. Mayor Savars brought up a good point yesterday with the food delivery for DOE. She's saying, can we ask Sodexo to buy local from the farmers so we can kind of support them and be shore up that segment of our economy, because they have the vegetables and stuff like that are easy to go out, and they're sitting on crops that are just growing because there's no they can't take it to market.
Right.
So is there a way that we can at least help that segment of the population, our farmers, and support our local farmers? So she made a good point, and it's going to be looked into and see how they do and see however Sodexo does their procurement. But if we're serving 12,000 meals a day, at least use
and running out, Mayor. They're running out of meals because there's so many people who you have to eat.
They used to allot mayors food at the end of the run, to hand out to people in poor segments of our population, and we normally get the call like at 12:45, Mayors, okay, we have 50 meals left over, 100, and we would be able to go out there, but now it hasn't been that way since I think the second day. I think we only got the first 2 meals, which was the flatbread pizza and chicken nuggets, and after that it's been so popular, and which is great. We're glad to see it kind of taking away, but going out there, but it's difficult to see, and what do we do? How do we feed the other people who are not have that ability to go out? About the weekends too. We had people inquire us about weekends. Is there going to be food on the weekends? So we already know that as the end of the month neared, people were already desperate because they were already out of whatever assistance they didn't have, and being home, you're feeding 3 square meals a day plus snacks. So if you're on any public assistance, it took a toll on them financially with that card. So everyone got kind of desperate in that end.
I was talking with Nestor in the back of the newsroom, and we were wondering if and hoping we don't reach a point where we see the government of Guam, going out and buying up. Because what you're saying about them buying the Golay, getting all the vegetables, I mean, maybe that's something the government should look at. Let's buy up these farmers' stocks and find a way to get it out to people who need it. That's something that we were talking about government, buying stockpiles of food to hand out for assistance, and it's pretty real out there. And
yeah. We want that, and one of the options that we also offered is, and for these end of the month situations, is let's tap into the MREs. We know they're out there. We know there's stockpiles, there's strategic stockpiles here and there, and if we could use the MREs, the military, I mean, that's at least that's nutritious, and we know it's able to help people. So,
I did have one question. Did you have some more, Chris? Do you want to?
No. Go ahead.
No, I just wanted to follow up on something that you had said regarding positive COVID patients that are from your village, and I just wanted to see if you could share with us how they're feeling, how they're coping.
It's hard for them. It's heartbreaking most of the time. Most of the time when I talk to the family, it's because they are Manumco and they don't understand the whole COVID thing. So they feel alone, abandoned. That family can't come see them. That they can't be held and touched. And they're either seen through a window or and fed. And then so they don't understand the whole ordeal of the home isolation. And so it is heartbreaking, and they feel very alone and very sad. So we're trying to figure out a way to do this as well. And we told the families are not breaking protocol. They're doing what they can, but they see that it's taking a toll on their mom or their dad. And so it's to hear those stories and to get those phone calls that when we call and follow up saying how's mom doing, how's dad doing here, and they say not good. They're confused, they're alone. Some of them have early dementia, and they don't understand what's going on. Why are they stuck in their room? Why are they being told they can only do this and that? And it's hard on the caretaker, and it's hard on the individual. And so I'm just waiting for those days to come where they can be cleared. So we're kind of counting down the days for them to kind of be able to get retested twice, so it shows negative, and then they can kind of enter back into their normal daily life as a Manumco, because they want to go out and garden, they want to go out and hug the grandkids and everything like that, and they're being told no Nana, you got to stay here, and no Tata, you got to stay here. And when I hear those stories, it just brings tears to my eyes, and I constantly tell the families, just keep trying to motivate them, get anything that they can do to get contact with the people out there. And for some of them, some of their loved ones are in SNU or at a GMH, and that's even more hard because they really are alone.
Yeah, Mayor. And I mean, just in talking with Dorgan Seuss's family and how they weren't able to say goodbye. It's just, man.
Yeah, it's hard. It's a disease that gets you both ways, because you're alone, and that's it's the nurses see the families, hear the families please on the phone saying, can you at least bring your phone in or a walkie-talkie in to talk, and there's a lot of restrictions on that, so it's very difficult. So my heart goes out to those families. So yeah, and we'll see, and we'll see about this arrival of the ship too. We'll see. We're going to see how that's going to.
Yeah, how do you feel about that? Some people are, don't let them out. But what the military is saying is that they're if they test negative, right, that they're going to allow them to be quarantined.
Yeah, I support our military. I think they do a fantastic job. But if they're negative, I think really just send them back to their homes of origin. Let them home isolate. If home isolation is good for everybody else, send them to the home. Send them back to their states. Because we have a lot of people on that ship that are from Guam that I'm pretty sure their families would be happy. If they're negative tested, go home then. Go back into, because I don't see why we would put somebody negative into in a place, but then we're out here populated by people who are positive in our communities. I don't see how it makes it. Why they are treated differently. Otherwise, put every resident up in a hotel that we can kind of self-isolate there. But I think send them to their places of wherever where they want to go, where they can home isolate and hunker down for a while. Because I doubt that ship's going to go out anywhere. Anyway,
right.
So
yeah, if you heard the press conference we played, they're saying that it definitely not going to be resolved in the next few days, and they're thinking weeks, maybe months.
Yeah, and they're flying in military personnel, medical professionals, from the Marines that are going to be here.
Well, if they could do it for a cruise ship, the Diamond Princess, and then put them in a base, they put them in several bases, they flew them out. I don't see why they can't do it here. I wouldn't do it here locally into our economy and into our thing. I know our hotels kind of need the business, but for the sake of our people on that end, I would just, get those planes ready and put them up and then bring them back and let them ride it out in Texas or in, California, whichever else like that, because they're more equipped to handle that. Because I am concerned for the hotel workers. I am concerned for the bus driver who has to take them there. I am concerned for the other people. And I saw Dave's interview, his stuff about, people being mixed up. They're not constantly under watch, so they're going to get bored, knock on somebody else's window, and especially that they're all on a ship, they already know each other, so it's not like total strangers. Yeah. So I say just get them on a plane and get them out.
It's a lot of planes.
Yeah, it's interesting. It was when listening to that press conference with Admiral Manoni, and Obviously the military has their procedures, and he was saying, no contact, there's no touch policy, and the hotel workers are going to be sequestered in the back. But what I think those plans don't take into effect is the chance of human error. And I mean, military might be in a lockstep in their response efforts, but the hotel workers maybe don't have the training. So there is always that wild card factor.
I think they just have to understand, if a hospital worker in a hospital environment can get infected, what more a hotel?
Yeah, we just talked to a nurse yesterday from New York, Chamorro nurse, and she was saying like I was wearing the whole full PPEs, and that's the thing that what's insidious about this virus is that how contagious it is.
Well, and this is a comment from one of our people watching on Facebook, and she brought up a good point. There's coronavirus in their hometowns too, so no matter where you move them.
But I'm not saying either their hometowns or the bases that took the people for the Diamond Princess. Those were regular American citizens, and they were quarantined. The ambassadors, they pulled out of China, and they put them on a plane, and they shipped them somewhere and hunkered them down inside a military base, which was a lot easier than, because like I said, if a hospital can catch it, what more a hotel that for some whatever reason a bed sheet is not cleaned properly, or a utensil from eating is taken, and then suddenly that just grows that way. So, there are concerns. Hopefully the professionals are going to kind of weigh that all out, but if it was up to me, I'd just charter a bunch of planes and send them out.
All right.
Well, there you go,
That's
Mayor
one way of looking at
Robert Hoffman.
Thanks, Mayor.
Hey, thank you, Mayor.
All right, take care.
Keep us posted. Remember, you're our guy in Sinonia. Well, just real quick, Mayor, I know the reason why we had wanted you to call originally was the burglaries in your village.
No crime.
I saw some pics that were on your neighborhood watch WhatsApp chat. Can you tell us a little bit about that?
Sure. It is unfortunate that we're still having to do with these with crimes in the midst of all this people sheltering in place, and we just ask our people to remain vigilant out there. There was an incident the other day in Affamy, and somebody kind of broke into a truck. It wasn't out of shooting. I think some of there is a photo of a bullet hole. They probably did use a gun, but to break the window to get in, and they took the person's wallet. But it was classified as a burglary, and happened around 1 and 4 in the morning. So we're just asking people. So last night, some people who were in that area specifically have really stepped up. So they're listening to the dogs, they're listening to nature out there, and those people that do graveyard and have to come in, they're also out there, so they're concerned. So I think they're really going to step up and kind of monitor their area. But the odd part is it happened in a very secluded part of Affamy, so that person should have been seen going in and going out.
You guys have a police station right there.
And that's why very brave of them for one to fire a noise that, because I'm not sure what it was. So they're trying to figure out if it was a pellet gun that shattered the window, it was a bullet, or, some people have their own imaginations on that end, but I'll let GPD do their investigation on that. So, but, we're glad nobody was hurt, and we are in contact with the person, and we've offered our assistance and what they can do to kind of just secure their belongings better.
Okay, Mayor. Thanks for that.
All right.
So just, everybody just be vigilant and know that there are some, like Bree said, what'd you say, knuckleheads?
Yeah, some knuckleheads out there.
Ooh, boy, man, it's not the time, guys.
No.
And so, Sergeant Paul Tapao, they've changed their whole response procedure because of COVID-19. And so they are asking the neighborhood watch groups to kind of step it up a little bit and fill in those gaps where, we've got police deployed to these quarantine facilities. So we're all stretched thin, we're all stretched thin. So 7-Eleven, KUAM-FM, Agotnia, Guam. We're going to get Tomas Maglotnia on to talk about what's going on in Saipan. We're going to run through the latest numbers of, if you're just tuning in. Something that I thought was kind of unfortunate was that all the news and the reactions about the USS Theodore Roosevelt, I felt that it kind of sadly overshadowed our third COVID-19 death. This was something that the governor had announced in a press conference yesterday, something that we've been covering. And I felt like that to me was, sobering to have that happen, and then 6 more positive cases, right, Bree?
Yeah, so the total number of confirmed cases of COVID-19 on Guam stands at 77. Again, the governor made that announcement about the third death related to COVID-19 during a press conference yesterday.
Right.
And then just the day before was the second one.
And then Saipan's death was also confirmed as COVID-19.
Right. They held the press conference on Monday when they made the announcement, the governor, or Esther Muña, I believe, about, I think he was 70 years old, suspected COVID death at the time, and that he had no travel history, but he had contact with one of the positive cases. And at that time, it was only 2 positive cases. So yesterday, the press release came out from the CNMI governor's office that that was confirmed. The 70-year-old man passed away from COVID-19. But on top of that, they had, I think, 3 or 4 additional cases for a total of 6 confirmed cases of COVID-19 in the CNMI, which includes a 70-year-old man.
And, we ran this press conference in the last hour. Could we just run over those numbers from the Roosevelt that the acting Secretary of the Navy, Thomas Maudley, had announced in a press? The military, it kind of been back and forth where they were putting out the numbers, and we had kind of really tried to take Linda DeNorcia of Public Health to task for them not reporting the numbers from the Roosevelt, and then it came out from Joint Region Marianas, where they said we're no longer going to give you specific numbers of cases on that ship or any ship for that matter, and they were only going to report the totals for each respective branch of the armed forces. But apparently that has now changed, as the acting Secretary of the Navy did give out some numbers in that press conference.
Right, he did. Acting Secretary of the Navy Thomas Maudley told media that there were 93 positive cases aboard the USS Theodore Roosevelt. 86 sailors are starting to show signs and symptoms. 593 sailors tested negative, and over 1,200 have been tested, but they're just waiting on the results.
There you go. So, we're anticipating with everything that developed yesterday that I wonder if they're going to start moving those 593 sailors out to the Tumon hotels.
Well, more than likely.
Yeah. So we're going to get to the bottom of that and get more information.
They'll probably have more information in the briefing.
Right. Okay.
The 1 o'clock briefing with the media.
7:16. It's containing COVID. Good morning, Guam.
KUAM News.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Hafaday! The soldiers and airmen of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war. Please stay home. Saga Gigimatmizu.
Hafaday, everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together, this war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat or Happy Birthday a couple of times, but make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers, and you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important. Nestor Lecanto for KUAM News.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Miss Arnett. Specialist Joshua Manzanotnia. I can't wait for him to come home. Keep us safe and stay home. I miss my daddy, and I can't wait to see him. So keep us safe and stay home. Dab.
Alpha Day Guam, this is Rocky Martinez, local MMA fighter. I'm doing all my training at home, so man, I encourage you guys, please stay home. Let's help the community out. Let's help the hospitals, the doctors, the nurses, everybody on the front line. If we all stay home, it helps them out. And the sooner we can do this, the sooner we'll get done. So I encourage you guys, please be a team player for the community. We can all do this. We can all help each other. And man, let's get through this. We're a strong community. So again, I encourage you guys, please, please, please stay home and stop the spread of the virus. Thank you.
Today, I'm Jonah Goncharfris, senior producer for KUAM News, and I'm sure you are probably tired of hearing it, but I'm going to say it one more time. I urge you to please, please stay home, to protect your parents, grandparents, manamko, loved ones, neighbors, hell, the entire island. Stay put, stay home, make sure you wash your hands, practice social distancing. I know it's hard because we miss hanging out with family and friends, but the sooner we do our part, the quicker we'll get back to our regular routine. We will get through this. Thank you, stay safe, and stay home.
Hafaday Marianas, this is Tomas Maglonia on the island of Saipan reminding you to stay home as much as possible. And when you have to leave your home for essential things, practice social distancing. Remember, you can still keep in touch with your loved ones online. We can get through this as one archipelago, one Marianas.
Buenas and Hafaday, mabuhay. What's up, Guam? I'm Norm. If you're watching this from home, then great. But if you're somewhere you don't have to absolutely be, please go home and stay there. I know it's difficult for us to change our routines and habits, and personally, I'd rather be with my family and friends dining in a restaurant or going to the movies, but the timing, it's just not right. We're asked to make a little sacrifice now, but in the long run, it'll help to ensure that you and your loved ones remain safe. We're dealing with an unprecedented health crisis, and we need everyone's cooperation. Let's fight the spread of the coronavirus by doing our part to stay home so that Guam can stay safe.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Guam's favorite, Baba B, pretty much honorary Chamorro.
He actually had a message on our KUM News Instagram story.
Right, yeah. Yeah, he's tight with a lot of Guam people. So that's called Guam Life from Baba B.
Nice.
Cool.
And you know, I love the music that you're playing.
Thank you, Sabrina. You know what it is it's partly that, if you play, I guess American music on Facebook, it's going to cut your feed because they got the copyright stuff. So, I kind of looked at the bright side and said, hey, let's do this show. Let's promote the local artists.
And speaking of local artists, this Friday, we've got a special live Local Friday living room edition. I'm encouraging everybody. You know, everybody's home. You should be.
Stay home!
And so we've compiled a lot of local artists that did some performances for us from their living room, from home.
Yep.
and we're going to be featuring them Friday night, 6:30 p.m., right after our primetime newscast.
Right, and it's really cool, and there's just so many local artists who are who know that it's a captive audience. I mean, people got to stay home, so it's a great chance for you guys to go live or to put out little videos. And I'm just the biggest fan of local music. Like, you go in my car, it's a thumb drive of local music, so I love it. I think it's great, and we just wanted to give an opportunity to get these guys to sing for you, and it's pretty cool.
It is.
It's pretty cool.
You know,
in
it's
their
like,
bahaki.
dear
They're
God. Yeah.
they're in their bahaki.
And a lot of them too have been impacted in the sense that they're not able to go out and gig anymore.
Oh man.
So this
Yeah.
is an outlet for them, and we are so happy to showcase their talents.
There you go. That's my co-host Sabrina Salas Matanani. This is Containing COVID. Good morning. I just want to say good morning to everybody who's commenting good morning on our Facebook live feed. I can't logistically reply good morning to all of you, so I'm just sending a blanket good morning, Guam. Good morning, Guam.
Good morning.
All right, so there's definitely a lot going on this morning. Let's go up to the NMI and check in with our man in Saipan, Tomas Manglotnia. Good morning, Tomas.
Hi, Tomas.
Good morning, Bree and Chris. What a week it's been.
I know.
What a day it's been. I mean, whew.
Today's Thursday. Oh man, I know things are really starting to get pretty crazy over there. So, what's the latest?
Yeah, and so as we've reported yesterday, the NMI Coronavirus Task Force announced that the death of a 70-year-old man on the island of Saipan, announced on Monday, is confirmed to be COVID-19. So what this means is that it's the first COVID-19 death related in the NMI. And the results came in early yesterday with news of more cases on Saipan. The current numbers, 4 new cases, including the deceased 70-year-old male. The others are 3 females, 1 77-year-old, 1 60-year-old, and the youngest thus far, a 14-year-old, all testing positive for COVID-19. The local hospital here is still waiting for the results of 12 specimens as of yesterday's press release, and these confirmed cases are in isolation, though it isn't clear if that's isolation at the hospital or isolation at the designated Kanoa Hotel. The governor's office telling KUAM that they will absolutely be not doing any home isolation of any positive cases, and the task force sharing with us that some of the cases did have travel history while others do not, showing evidence of community spread. And again, as reported on this special report on containing COVID-19, Guam Public Health Director Linda DeNorsi tells us that 5 tests are set aside for the NMI per day on Guam, in addition to those which might be sent off island. We also obtained new information overnight that a number of quarantine travelers will be transferred from the designated Kanoa Hotel to Pacific Islands Club Resort for more precautionary measures. I spoke to one of the quarantine travelers who is being transferred, and he told me that low-risk quarantine travelers are going to be transferred to PIC Resort. Meanwhile, as we also reported last night, effective April 6th or April 30th, United Airlines will be suspending flights between the NMI and Guam at the request of CNMI Governor Ralph Torres. The last flight between the islands is this Sunday. And also last night, some new information, Star Marianas is joining that decision. They announced yesterday that at the request of the governor and the mayors of Rota and the mayor of Tinian, Star Marianas Air will temporarily suspend its scheduled flight services between the islands for commercial passengers. So that's the latest in containing COVID-19 in the NMI.
What about like mail and medevac? Is that still
Yeah, so United Airlines and I believe in Star Marianas' announcement, they said that they're still going to conduct those essential medical services and assist in anything related to COVID-19 as well with their airline. We also received some press releases shared the other day from CPA saying that air shipment of cargo services to and from Guam and within the CNMI is also provided by Micronesian Air Cargo, and that the U.S. Postal Service's air shipment of cargo to and from Guam and medevac transport for health emergencies will not be disrupted by the temporary suspension. So I think for the most part, it is just affecting the commercial passengers.
Has there been any information for the people that are traveling from Guam into the CNMI within this tight window? You know, you mentioned that the flights are going to be canceled or suspended starting Monday, I believe. So the people that are traveling back to the CNMI in between this time, are they going to be subject to any sort of quarantine?
So my understanding as it still stands is that anyone entering still is subject to that quarantine,
Okay.
whether a CNMI resident or, for some reason still a tourist making their way here. And so that's the latest information. I think we also shared in the newscast last night or the day before that if you absolutely need to make it, you should call United right away. And
Right. I wonder how that worked out because, imagine all the people who were like, oh, my God, I got to get back to Guam or, vice versa. So I wonder how fast that plane filled up if it wasn't already full.
Yeah, those are numbers I'm interested in too. I think right now the latest numbers show there are, at least 100 people, travelers in quarantine. We haven't received any specific word in terms of whether or not some are exhibiting symptoms or things like that. But for the most part, the quarantine definitely remains in effect. And I think one of the biggest things is that, the governor's office sharing with us yesterday is that home isolation is not going to be done for any positive cases, which I know is often a question that is asked by the community. We also tried to get information on the villages. They cited HIPAA, saying that they can't release that. And then after, kind of asking for just general regions of the island, they said they're going to go ahead and ask our local hospital to look into that for us.
Right. And, like we were talking, Tomas, the other night, we kind of here on Guam laid out through the way that, the media has been reporting on this COVID-19, what is acceptable. We also, I know, made the ask, the mayors are making that ask about can we get the villages. I don't think they're going to budge on that. And so I think with the doctors, the mayors, and, it seems like so long ago, Brie, it was just a couple weeks ago, everybody in their Nino was writing letters calling for more transparency in the COVID-19 response. And I don't know if I could say they made great strides because there wasn't a lot of transparency. And so now what we get with these demographic breakdowns, I think really puts people somewhat, maybe a little more at ease to know at least the region.
Mm-hmm.
Yeah, and Bree and Chris, one question that I've asked now several times, and I think it's one of the first questions I asked the office here once I landed on island, is what happens for cases on Rota and Tinian? I know that there are no confirmed cases there, but I think that if we need to have an answer for that now, and it's something I resent my question to the spokesperson, and I'm hoping to provide my family on Rota and my friends on Tinian some insight about what happens. How prepared are we if we are going to have confirmed cases on Rota and Tinian? Are they going to be flown to Saipan? Do we have the capacity there on Rota and Tinian to do that? Are they going to be flown to Guam? As I pointed yesterday, that last situational report we saw shows that Rota has 1 ventilator and no listed ventilators for Tinian. So I personally am trying to get the answer to that question because I know a lot of people tuning in from Rota and Tinian also want to know what the capacity is if there are confirmed cases, just for preparation.
Maybe we should split it like anybody in Rota, they can come to Guam, Tinian, they go to Saipan. You know what I mean? Because of the geographic
closeness. Get some answer soon about that. And
right.
I should also mention that Directive 14 was released by the governor's office yesterday too, announcing that effective immediately all business engaged in gaming, including the casino, video poker establishments, and e-gaming facilities, and recreation and amusement facilities will be shut down. So I know that in a previous report we were talking about those poker parlors being open, and so this new directive...
It's kind of like, seems like it would be a vector with all the touching that goes on in the game rooms and the poker rooms. I mean, just people touching their greasy face and touching them buttons and touching their crack pipe and then touching the buttons.
What about the grab and go program? I'm not sure if you mentioned that. Is it still a go inside Rota?
So it's suspended now for all 3 islands as of yesterday. I think it's worth mentioning I've tried to call the Commissioner of Education and also the Child Nutrition Program that the press release provided a number for. I haven't heard back yet, but as I shared yesterday through our chats, the Grab and Go Meal Program is now suspended for all 3 islands.
Mm-hmm.
Right.
I'm not sure if it's until further notice or just they're not going to revisit it or not. But that's the official case here, and I know. Some folks were really relying on that, but also balancing the safety of some folks who might, want to leave their home at this time.
Tomas, one of the things that was kind of alarming was that positive COVID-19 case, a 14-year-old in a Saipan. I know you're not getting much information, but is there anything else you can tell us about that? Maybe even what are people saying about that?
You know, Chris, there's nothing confirmed. I know in this time there's a lot of things on WhatsApp that's being forwarded, but at this time we just know that it's that 14-year-old girl. There hasn't been a press conference as of Monday, that last one that we reported on, so we don't know more. We don't know if these new 3 specific cases, other than the deceased man, had contact with the first 2. We don't know, again, if it's related to that faith-based organization or not. We're not getting any official word on that at all. Though I think it's also interesting to point out that the mayor of Tinian released something on March 31st saying that members of a community associated with a faith-based group in Tinian are being attacked on social media. And within the community, he put out this brief press release condemning those actions, and how pointing out that the virus does not distinguish between ethnicity or faith or nationality. It can affect anyone, is what he writes. Mayor Aldon writes that, encouraging everyone, again, to stay home and social distance. So, you know, we don't know. I know, Bree, you asked that question in the press conference, and the governor, you know, said that he could and could not confirm what could or could not be, right? That was
for the most part.
What?
Yeah.
Could not confirm what could or could not.
Yeah, that's basically what he said. You can't. We don't want to go around saying, you know, spreading misinformation or whatever. But yeah, he wouldn't answer that directly, whether or not it was linked to the faith-based organization.
Right.
Because there's only, at the time, there were only 2 positive cases, and you know the contact didn't come from the hospital, according to Dr. Beth Conan.
Right. Tommaso, what do you make of the home isolation? You know, that's kind of been a real anxiety point for people here on Guam, is, you know, and that's kind of also brought on the mayors asking to be informed if there are COVID-19 patients in their villages. Would you say maybe the NMI ahead of Guam on that curve, and that you guys are putting all COVID-19 positives in these isolation of facilities, as opposed to sending them home like we do here?
Yeah, I think that definitely is something that you know, was new last night. That was passed on to KUAM. I do know that, you know, I'm not sure. I heard that there were 4 hotels now being used, but so far, right now, all that was sent to me specifically was about Kanoa and PIC, and I think the travelers being moved was definitely something that was, you know, not expected. We did ask how the facilities were being monitored. They said there's 24-hour monitoring at those facilities that are there, and also separation through the different hotel floors and rooms. I should also mention that the Department of Fire and Emergency Medical Services is expanding their personnel as a part of the task force here in the CNMI, and so some of their primary objectives on the front lines is to transport passengers, the remaining passengers, from the airport to the designated hotels, escort the passengers to the assigned rooms, deliver drop-off items into the rooms for any POI cases, and then they're also tasked with decontaminating everything after drop-off, assisting THC medical personnel, and then also conducting secondary health assessment for all passengers. So, you know, there seems to be a full force. I also saw last night that, you know, some people were cited for being out after the curfew time. So, again, the curfew is expanded to everyone except frontliners and those in private sectors on duty. But
what time is that curfew? Again, if you guys are just tuning in the NMI, they have instituted a curfew for everybody.
Yeah, so that's 7 p.m. to 6 a.m. And as we've been reporting, there are some exceptions to that as well. Mm-hmm. But you know, I saw yesterday folks commenting in different news stories that that they're definitely taking that seriously, and people are being cited. So we can confirm that.
Tomas, if you could provide clarification, you mentioned the Kanoa Resort and you mentioned PIC. Are they separating now? Quarantine and isolation, like one is an isolation facility and the other one is a quarantine facility? Because, you know, early on everybody was being transported to Kanoa Resort, whether you were in isolation or whether you were in quarantine.
Yeah, you know, I asked that question to ask, like I said, the person who I spoke with who was being transferred to PIC, one of the quarantine travelers told me that low risk quarantine travelers are being transferred. I asked the governor's office, and their response was, here, I'll just read it, quote, "They're isolated. I'll leave it at that. Can't divulge any further." So, again, I don't know. One would, Dr. Beth Conan at that Monday press, he keeps citing this Monday press conference. It's the last we've heard. So,
yeah.
At the Monday press conference, Dr. Beth Conan, the medical doctor at the local hospital, says that if patients need help, they'll be at the hospital because Kanoa Resort is not a hospital. So, folks can kind of make what they do with that information, but at this time we don't know if there are specific cases just for isolation and just for quarantine. But things have obviously changed with, the situation.
Okay. Well, thanks, Tomas. You be safe over there.
Wash your hands, boy.
Thanks. I will, and encourage everyone to. Again, I've got to thank all the frontliners, especially here in the NMI, dealing with this situation now. That's really great. So we appreciate everyone from the first responders to the medical workers, and we hope that we can get more supplies and PPE for them through the government, through private sector, whatever it is. We want to make sure they're safe too,
All right, Tomas. Thank you so much.
Thanks, guys.
Okay, take care.
Tomas Manglotnia reporting for us over in Saipan. Of course, he was a university student in California, and all the classes have been moved online. So one of the first things he did was get his dog in home.
Yep, and he's been taking classes early in the morning.
Right, so he's taking the online classes in the hot room. He was telling me.
Yeah, and he's helping us out, keeping an eye on what's happening over there in the CNMI.
Right, 7:40. We're doing news. Take a little break, and I think we're coming back with Democrat Senator Sabina Perez to get her take on this whole Theodore Roosevelt situation. Also on tap this morning, trying to get Dr. Shea on the line to talk about what the deal is with moving these maternity patients out of Guam Memorial Hospital. There was a situation in the press conference yesterday. We do. Okay, so we'll do that when we come back at 7:40, containing COVID. Good morning, Guam.
KUAM News Updates are...
Howdy, everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together, this war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat or Happy Birthday a couple of times, but make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers, and you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important. Nestor Lecanto for KUAM News.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Show and Deputy Attorney General Shannon Titano present with DeNorcy. Representing the Office of the Public Defender was Attorney John Morrison. Arguments were heard from all parties, and the court is taking the matter under advisement. Reporting for Guam's News Network, I'm Adriana Cotero.
And late Wednesday afternoon.
Good day, everybody. I'm Sabrina Sauce-Mazzanotti.
And I'm Chris Barnett. Join us bright and early weekday mornings on I-94 for KUAM News' Containing COVID morning radio show. It's also being broadcast live on our KUAM News Facebook page.
You know, we don't want to be doing this forever, and you probably don't even want to listen to us forever. But that's why it's so important that you practice social distancing. You know the drill. Wash your hands.
And stay home! Just stay home!
Stay home!
Ah!
Hafa Guam. My name is JJ Ambrose. That's Juliet. This is Isabella. And that's Applejack. For the last 2 weeks, pretty much since she was born, we've been stuck at home in quarantine. I miss my friends. I miss family. I miss going to the beach. And I definitely miss going to school athletics. But the silver lining is I get to spend more time with them. We've been catching up on homework, working out, and I've been changing a whole lot of diapers. But I know there's an end to this. We've been doing our part. We're asking you to do the same thing. Stay home.
It's containing COVID. The KUAM News takeover here, the second day of April. Of course, big news, 6 new positive cases. Is it 6 or?
Yes, 6 new positive cases. That was the latest information from the Joint Information Center just before 10 o'clock last night. 41 tests were run yesterday, so we're back up to 40.
Right.
So 41 tests were run yesterday, 6 tested positive, 35 negative. The overall count, this includes positive cases from the military, so a total number of 77 confirmed cases on Guam of COVID-19.
All right, and some developing news as we speak. They're getting out. Quarantine is
Some of the quarantine.
These are people who flew in from
Manila,
and our man in quarantine. He's been such a valuable asset for us. I don't know if he's expecting a check after all this for being our quarantine correspondent. Dave Sablon. Good morning, Dave.
Dave, you there?
I'm on front desk.
Dave? Yeah,
He's
at the
probably.
front. Yeah.
Oh, he's at the front desk. Okay.
Right. So if you've been watching his videos, and I know people have, Mayor Hoffman was saying that he watched them. You've been following Dave's story. He came back from the Philippines. I think through
Manila.
Through Manila.
Yeah, and he didn't have when he came in. The governor had just announced a mandatory protocol for everybody that was coming in from the Philippines, and so he didn't have the time to get that 72-hour medical clearance for COVID-19. So he came in and he went through the entire process at GIAA, and then next thing you know, he was on a bus and over to Days Inn.
Right. And so now a bunch of those, and these were the first people that we quarantined, the first
this
batch
was the
of
19th,
travelers.
March 19th.
And I think it's important for you guys to know that we are still quarantining travelers. There was a flight that came in.
Did you hear him?
Yeah, I did.
I
Dave,
heard the woohoo!
Dave, are you there, Dave?
Yes, good morning, Bree and Jace and Chris. How you guys doing? Happy day. Good morning, Guam.
We're probably not doing as good as you. I know that. So you're getting out today.
Yes, we are. Group of people already left this morning. They're early risers. They're waiting on I think the 8:30 mark around, and they'll have people that needed assistance with transportation. Will be heading out at that time. Public transport will be coming to pick them up and drop them off at a designated location where they can await rides. But yeah, most like I said, the early risers got up and they left, and just waiting.
Dave, I know that you came back here to be with your parents. So, are you going straight over to them now that you're in a quarantine? Or are you going to do any extra measures? Maybe cooling down for a few days. I don't know.
No, I'm gonna just go and continue my quarantine there for a little while longer. Just to be safe. I'm confident that I'm healthy. I came healthy, confident this whole trip coming here. It's the process of being in this quarantine that concerned me. But other than that, I have not exhibited any symptoms. My temperature checks every day were normal, just like everyone else, aside from the couple people that turned up positive.
Right. How is that, Dave, mentally for you guys? Because I got another friend who was in quarantine, and he was saying that people were kind of anxious about that.
Yeah. Well, I think when we found out, we confirmed that it was one that we knew of from here specifically. People that I spoke to, they were very concerned. I mean, because no one knows if they had contact with this person. There was no back tracing as to whether this person was in contact with anyone. I was personally in contact, close quarters with him at the beginning of this, but that was at the beginning when we first got quarantined. So I'm sure it was asymptomatic at the time. I was always careful never to remove my mask around anyone. So, I requested a test. They never got back to me about doing one or not. So did a friend of mine who was in contact with him most recently on the transport from the other hotel to Pacific Star. He has an underlying health condition. They, I guess, are going to hold him over for another 4 days to be sure. They're still not going to administer a test according to him as of last night. But, he has an underlying health condition, and he's concerned because he had direct contact with this individual a little over a week ago.
Dave, let me ask you this, to be fair, do you think, are you confident, and you think that people should be confident that the travelers that we're letting out of quarantine who haven't been tested for COVID-19 are clear and safe to be released out into the community?
Man, that's a tricky question there. It's after 14 days, you should be okay from everything I've watched and researched. But this thing can manifest itself, even a couple weeks after we're released, a week, even up to a week and a half after we're released. If they continue to just stay home and continue their quarantine and, keep their distance from their family members till that time, then if nothing, they don't show any signs, then I think they'll be okay. But this is a good start to show that, at least the first 2 weeks where it should manifest itself, at least the first 5 to 7 days, it should start showing signs. So it can give some sort of relief that, you're on your way to a good health. But it's, I don't know.
Mm-hmm.
I'm like I said, I'm confident because of all my academic practices the last couple months.
Right.
All the way to my arrival here. I was only in Manila for 3 hours. I didn't mingle with anyone, so I didn't have contact with anyone that may have been a virus carrier from Manila. I was only in contact with people from Manila throughout the quarantine process because they put me in that situation.
Right. But Dave, the governor during the press conference yesterday had said, I think she said something like people in quarantine are actually happy that they're in quarantine. Is that something that you would agree with?
I'm happy that they're finally doing something to try and stop the flow of this virus into the community. You know, they're able to catch people in the quarantine process that manifested signs and put them in isolation. So, you know, that's a good thing, because otherwise, like I said, if they had gone home and didn't show signs, and I hope everyone is honest, you know, and not scared, because if you get it, you need to go and seek help and not deny it. You need to go and seek help. If you're in denial, you're just going to make everyone around you sick.
Yeah, and I think that
want to do that.
That has to be said, because us Chamorros, we got a thing with going to the doctor, and, you know, a lot of times nobody want to go to the doctor until they're, I mean, you're seeing it with some of these COVID-19 positives. They're showing up at GMH presenting with, you know, already at the end stages of the virus.
Yeah, because, you know, the individual that had contracted it here, he was sure he wasn't going to get it. Mm-hmm. And he ended up with it. So, you know, I'm sure his you know, his head is spinning. But, you know, he manifested signs early on at the other hotel, and the public health people didn't catch it, because he told the public health officials when they came around to do a temperature check that he lost the sense of smell and taste. And that's something I saw on a news report a little while back.
Yeah, we just we did a story yesterday with a nurse from upstate New York, and she has COVID-19, and she said that was one of the things.
Yeah. I saw this. I think some people in Asia, when they recovered, they did a news story, and that was one of the things they said they had experienced. And so shortly after, I guess they tested this individual, they came around, and that was added questions to the questionnaire, if we had lost sense of smell and taste. You know, I could smell and taste perfectly. You know, I just want to go home and taste some good home cooking. You know.
Are you going to be cooking? What's the first meal you plan on having?
You know, before I came here, my dad had barbecued some ribeye and some, you know, T-bone steak, and I didn't get to try that. There's some beef stew that my dad makes that I love, so I think I'll have some beef stew. A lot of dry food here, you know. Want to eat something, you know, more wholesome.
Mm-hmm.
Right. Yeah.
I I don't really care what it is, as long as mom and dad's home cooking right now. And then, you know, I'll start cooking after that. I just want to have some good barbecue. I haven't had some good barbecue in a long time.
There you go.
I love barbecue.
Good for you, Dave. I feel like you guys are all getting out of jail. The vibe, you know, it's been like processing out, bro.
Everyone was anxious, but you know, there was a lot of anxiety when they were going to court, and you know, there was uncertainty whether we would be let out after 14 days. And a great suggestion by one of the people that are in quarantine from the States is they should just try and get everyone's email address and try and give a blanket email of an update of every day, because we had no info. They would come by, service papers, and take off. You know, they served me papers twice. I asked the second time what it was, and the guy said, "Well, I was just told to give it to you." I said, "Do you know what it pertains to?" He said, "Read it."
Wow.
It's split. Yeah, like, you know.
Damn process
So
servers.
there's no information that is being disseminated to the people in quarantine, and that would go a long way to, you know, quell people's anxieties or, you know, any concerns they might have. You know, just, hey, this is a formality. We have to go to court for whatever reason, but you will be let out as planned. That's what I'd say, because when people start hearing that on news or reading in the press, you know, yeah, people were really concerned about that, and, you know, oh, screw that, I'm going to walk out here anyways. What are they going to do? Arrest me? You know. And my friend observed that has a heart issue. The mom was reaching out to me, can you please calm him down, because, you know, she was really concerned for him. So maybe, you know, a pointer for GovGuam to maybe in the future help ease people's minds by, you know, doing that if possible.
Yeah, and, you know, we just got new quarantine people in last night, so I mean, hopefully they'll, moving forward, find some way to better loop you guys in, because they're not going to keep a lid on it. I mean, you reached out to us. We get messages from people in quarantine all the time. So
yeah, it will go a really long way to, you know, make people feel better about this whole quarantine situation, and just, you know, a little more forthcoming.
Right.
I feel that people should know the sites that people did turn up positive, and maybe it will, I'm sure it'll concern them. But, like I said, there's been rumors that people do leave their rooms. I heard last night that my cousin upstairs, he heard commotion in the hall, and I guess some of the public health people, they were escorting an individual because he was cruising the halls, and they're telling him, hey, you're not supposed to be out. Get back to your room. So, I know people took the wrong way that, oh, you guys are adults or what. Yeah, but people, I can't control others. People are going to do what they want. If they leave their room, then the quarantine is useless because you didn't quarantine them properly. They need to be in total isolation and away from everyone else. If they start mingling with people and whatever, someone that they mingled with had it, and it didn't manifest itself, and they both left, and you thought, oh, it's a success, but you didn't catch it, and you let them back out and reintegrated them into community, but they're both asymptomatic, then they're going to spread it. So it needs to be strict. And if it needs to be that people need to be put a guard on every floor to make sure that they stay in the room, then if that's what needs to be done for this quarantine process to be, successful, then that's what needs to be done.
Was that how it was set up?
That they should do it. Huh?
Was that how it was set up, that there was a guard on every floor?
Oh, no, there's only guards at entrance.
Oh, okay.
Like I said, if I want to go upstairs and hang out with someone, I could.
Yeah, okay.
I could walk down the hall. I mean, most of the time, the only time there's people in the hall is with, when they're doing your temperature checks or serving you your meals. But other than that, yeah, people should stay in the room and be adults about it and be responsible. But like I said, I can't police people. They have to police themselves.
Right.
I'm just pointing out issues that I saw or I heard about. I didn't personally witness it, but I heard through the grapevine that we set up here that they hear people next door like they're having a party, drinking alcohol. I don't know if that's true, but that's what I heard. Rumor has it. And if that's the case, then if that's happening, then they need to police it better and place a guard or something on every floor to make sure that the quarantine is a success. Because if people are able to freely roam, then what's the whole point of a quarantine?
Right. Good point, Dave. Enjoy that beef stew, my friend.
Thank you. Hey, I need a haircut, man. So if you ever find that barber, and that's how drastic the situation was, that I wanted a haircut for weeks, and I refused to go to the barber because of this COVID-19.
Right. Yeah.
It's that scary.
Just
at least where I was.
Shave it all off.
Yeah, I actually might join the Marines because my dad does that kind of haircut.
And send us a picture.
Yeah.
That's going to be my first thing. He's going to get cut my hair.
He's going to be so happy when you get a little flat top. Thanks, Dave.
Okay, man, you guys take care.
Take care.
There you go.
Wash your hands.
Yes,
That's
always.
right.
Yeah.
Right. Okay.
Hey, he's our man in quarantine. Well, he was our man in quarantine. What's really interesting about that, Bria, is here's a guy who just spent 14 days, pretty much locked up in a hotel room. And what is he saying now that he's leaving? He's saying they need to lock it down more.
Yeah.
So I guess, maybe that's what the governor meant when she said in the press conference that, people are actually happy to be in quarantine.
And you know what, Dave, it's last week, because, he's been giving us all these reports that we've been posting. I had actually asked him, what's your room number? Because I wanted to deliver something. And he was like, don't you dare come down here, And I'm like, wow.
Right. Yeah. Well, that's 801.
Don't put your life at risk.
Senator Sabina Perez on the show. So, with this situation coming out with Roosevelt, and even before that, some of the community groups that you're used to hearing from on build-up related issues had sent a letter and basically implored the governor to kind of call on the DOD to provide more transparency and things. And I think that they had also mentioned commissary privileges and so now with the news that came down nationally about the sailors who are going to be quarantined in Tucumán hotels, I know that Senator Sabina had come out with some comments about that. Good morning, Senator.
Good morning, Chris and Sabrina.
Good morning.
Let's just get right into it. It kind of seems like it's a done deal. So what are we going to do moving forward to kind of address the concerns, the very real concerns that you have, Senator?
Thank you, Chris. So I just wanted to clear the record that in my letter, I provided solutions that would protect the community in addition to protecting and helping provide humanitarian relief to the crew members. So I just want to be clear about that because it seems that people are construing my letter as being against the health, and so I just wanted, one of the recommendations that I had was that they should continue the quarantine, but in spaces on the base. As you know, there are many facilities that are vacant, and they have space, many acres, over 38,000 acres, to construct these temporary things that could provide a sufficient quarantine facility. So I just wanted to clear that up first. And really the primary focus for me is protecting the health and safety of our community. As you know, last week it was reported that Guam may be experiencing a breaking point in the front line, in our medical front line. We only have 15 ICU beds, and we have about 50 ventilators. So, really the best line of defense against this very dangerous virus is quarantine. And the other thing about, testing negative. So, the issue is that, there may be a period of time before a person can show in their, can show the positivity in that they're positive. So, to me, this is still, and the potential, there's false negatives in the testing. I think that this came out in one of the news questioning, a line of questioning nationally, that there were some false negatives. So I think it's important to, provide more protections. The quarantine on base, I think, still is an option that should have been pursued further. And if it's still not too late, I think I would definitely urge that to happen. Obviously, they need to disembark the ship, except for the non-essential employees, and decontaminate that. Treat the members, those that need treated, and quarantine and self-isolate as we have been doing as a community at large. I think it's ironic that people that are flying in from the Philippines are quarantined, but here we have a population that are potentially exposed, and then there are where they have facilities. There are facilities on base that can be utilized. I think that those areas should be utilized to its fullest extent, and the hotels. That opens up another possibility of spreading it to the general population. For the members that are the service members that are providing, the cleaning of their, taking out the trash, cleaning the linens, those sorts of things are potential sources of spread. And my interest is protecting the health of everybody, protecting our community, who is at a disadvantage, materially. As far as especially with our healthcare system, we don't have the capacity, and we know that there are at least 150 people that have tested positive, and that those 150 could potentially have exposed the others on the ship. So this is a huge concern, and considering that we're doing all we can to contain the spread within our community, this is not, I don't think this is a wise decision. And if it can be recalled, I really would like to urge that it happen. But given that the decision was made, what is the contingency plan? What are we doing to prioritize protection of Armanumco? What are we doing to protect? Now that we know that there's a potential to expose the community further, what is contingency plan? What are we doing to protect the community now that there's an increase in this?
So this letter was also given to the governor. So have you heard from her? I mean, she knew about this a couple days ago.
Yeah, this was just yesterday, and I did not receive a direct response.
So, Senator, are there two? So we have the Hagen letter, which is from the Chamorro Women's Group, and then you have also written letters. But you were part of this Hagen because this was 8 or 9 different community organizations that tacked their name onto this. But I just want to go back to the press conference yesterday. I don't know if you got a chance to see that, but Rear Admiral John Manoni, it was like a surprise guest appearance. You know what I mean? Our jaws dropped in the newsroom.
Well, it already dropped after hearing the 3rd confirmed death.
Yes, so there was that, obviously. And then Admiral Manoni came on, and I think it was Nestor Lecanto, our reporter, asked him, what assurances can you give the people of Guam that we won't be placed at an even greater risk? So what did you make of Admiral Manoni's response to that question? I believe he provided 2 assurances. One of them was that only sailors who test negative for COVID-19 will be allowed to quarantine at the Tumon hotels. And then I think the other reassurance he offered was that they would be quarantined in accordance with the procedures laid out in the Uniform Military Code of Justice or something like that. Yeah. So what
And
did you make of
CDC.
those reassurances?
Yeah, to me, it was not reassuring. Well, first of all, I didn't draft a letter with the group, the Hagen, is it Hagen from Malawan? Yeah, I wasn't part of that draft of that letter.
Right.
Yeah, so my letter was a separate thing. Yeah, to me, it's there's several things that I think are concerning. Is the testing of are they false negatives, and when did they test him? And during the time from testing to now, have they contracted it? Now that they are still in close quarters, I think we need to clarify that before any kind of movement happens. I think, again, I would like to urge that they use the facilities on base to the fullest extent possible. And then also they're closed. Things, the virus is known to last outside the body for a period of time. What about that, accidental exposure? So, are they going to come naked to the naked and negative? So, we need to make sure, or decontaminate it, decontaminate them. I mean, obviously I don't want them to be quarantined off base, let them quarantine on base. There's enough room there. There's enough facilities there.
Well, Senator, let me just ask you, what is the difference between a sailor testing negative and a regular average Joe or Josefa Cruz testing negative? Because when they test negative out here, we send them home. And I understand your concerns about the exposure, but how do we have any faith at all in the testing if we're just going to say that even a negative result is not satisfactory to us?
Yeah, and I think in my letter I offered that solution is there's a lot of space on base. It protects them and it protects us as well. So and they can get treated at the same time. So there's no reason why we have to jeopardize the community of the health as a whole when there's other options available to us.
How come you guys haven't called out the governor on this? Because it's apparent, in the chain of events that have unfolded with the military. It's clear, I think, that the governor had been involved in negotiations with Joint Region Marianas, with the admiral at Indo-PACOM and Admiral Manoni. So, one of the first letter, I think, from the Hagen Famalawan group really kind of painted the governor as a victim in all this and its tone, in that, DOD is making these decisions without you. But I disagree. I think the governor is a willing participant in these negotiations. And when we tried to ask her about that, the answer that we got was go ask the admiral. And so reconciling that with national news events where we see on CNN, I mean, it's a case of like last to know that these negotiations had been going on for a few days with the governor. So we're talking about DOD, and we're taking this tone that DOD is making these decisions that we're not involved with, but the woman that we elected to represent us is involved with these decisions. So how come we're not putting more onus on the governor when it's clear that she has agreed to these things?
I think hopefully from these discussions that would come out more. Because
it's all there, Senator. If you watch the media, it's clear that it's been laid out that she was involved.
And this letter is addressed to Rear Admiral John Manoni. Do you plan on sending a similar letter to the governor?
Maybe you should do like a CC kind of thing. You did.
My last letter was to the governor.
Okay.
So yesterday's letter was to the governor.
I don't think I got yesterday's letter. Did you?
Yeah. So what are we going to do next, Senator? I know you're making you just made the ask that you want to see this revoked. Realistically, that's probably not going to happen, right? So what are we going to do then? Are you just going to continue to call for more transparency, maybe, in this whole process?
Well, this afternoon we have a call with Rear Admiral Manoni.
Right.
So I would definitely raise those questions with him, and definitely do follow-ups with the governor regarding perhaps revoking this decision, because I think I feel like they need to exhaust their options, which I feel they haven't. I mean, what have they done to do that? Really, the safety of our community should come first.
What are you going to ask Admiral Manoni? Yeah, sorry, Bri, they're doing a briefing with the Admiral this afternoon on Zoom, all the senators. Are you guys going to ask for some tests or something? I feel like this is an opportunity for the governor to kind of leverage. I know that they're bringing out some Marine doctors, and the idea, hopefully, is that they're going to stick around after and assist with whatever's going on here locally with COVID-19. But, you know, I'm thinking that we're going to ask, you guys asked the governor to pause the buildup. She totally ignored you guys. We're going to keep asking. The answer is going to still be no. So are we going to try and leverage something out of this in terms of, hey, give us some tests? I mean, they've obviously shown the capability that they can test. How many do they test? 1,200 sailors.
Yeah, 1,200 sailors waiting for results.
I think, like you said, you know, perhaps the transparency is not there, so you know we don't know what was discussed regarding that.
You don't know because the governor's not telling us. Sorry, Senator. It's just a little frustrating because I feel like, you know, transparency is needed. Yes, of course, DOD, I'm totally on board with you guys. We need to know what's happening on our island. But at the same time, we also need to let the governor know that, hey, you got to clue us in too. Don't keep us in the dark. And I just want to see that fairness, you know.
Yeah, I mean, I addressed that in the letter as well.
Thank you.
As far as transparency. But yeah, trust that I will continue to, you know, work to protect the community, and that, you know, that I have their interest at heart, ensuring that we can stop the spread of this disease, this very dangerous disease. And considering we, you know, especially we have Manumco in our community, we need to be able to prioritize them, especially at this time.
You're right, definitely, and we can see where you guys are coming from, because I mean the fear is real. We have 77 cases, 3 fatalities, and so we definitely know what place you guys are coming from. Senator, anything in closing that you want to add, or Sabrina?
No, I'm just was going to ask if you could send the letter that you sent to the governor, because I only got the letter that you sent to Admiral Manoni.
Oh, okay. I apologize. I thought we sent it out to all media contacts.
No,
okay.
Didn't get that.
Okay.
All
So
right,
what
well,
are you going to
just,
do? I'm sorry, did we already cover the fact that you know, it's more than likely that this is not going to be revoked?
Yeah.
And I think probably people are going to have to accept that.
Yeah, and I think too it shows the you know, the military, you know, as far as security is concerned, you know, we you know, our security now happens to be protection from this disease. And so we need the military to understand that you know, what they're doing is endangering our security, and that they have resources available to them, many resources that they can use to protect our island. And I've enumerated them in my letter. You know, I've spoken on this before, and you know, our security is the health of our community at this time. Mm-hmm. And so what they're doing is not helping our security. And as far as, you know, humanitarian aid, you know, I in my letter I did recommend that they engage all those resources that they have. You know, the U.S. military has superior logistic capability. You know, and this is a time of the need of the military. Why are they not using those resources? Why are they holding back? And this is not just a Guam issue. This is a whole military-wide issue. And you know, it should not be borne by our community alone. This is has to be a community effort, both local side and national side.
Senator, what are your colleagues saying on this? Are they coming down on one side or the other? Because it's a very complicated issue.
I haven't heard that much from my colleagues, to be honest.
Neither
yeah,
we
haven't.
Yeah, neither have we. No session or no. Hey, how'd you feel about session, by the way, Senator? Did you want to go into session or?
So yeah, I'm open to distance virtual sessions. I think it's a wise decision. I think we're working out the kinks in regards to that, and minimizing the amount of contact, because some of my colleagues have traveled. You know, I don't want to expose.
Oh, that's an understatement.
I don't want to expose myself and therefore my family to the virus. And so I want to participate in a way that's safe. And I believe we're going to be coming out with some rules. We have to amend the rules in order to engage again. So
Right.
That will be happening shortly.
Okay, so yeah, because we're not hearing from the rules chair. It's crickets with rules chair Senator Regine Bisco-Lee. Maybe she's self-quarantining, but we really have been talking about this and how difficult it was supposed to be to do a virtual session. So yeah, we just want to know. People are hurting. We had the Vice on yesterday, and she kind of summed it up. She said, "I don't like it one bit that we're not doing anything to kind of plug the gap between today and when the federal assistance comes down." And so,
yeah, I just want to also provide some advice, some news. So I was on a conference call this morning, and so the federal government, they have some deadlines about when they're going to disperse the money, and so there's within, I believe, April 24th. They want to disperse the federal funds to the local government. So we're working very hard behind the scenes trying to facilitate that, considering that Guam is delinked in many ways from the federal government. And I'm sure the administration, too, is working very hard on this. So we're working to see how we can get the money to the people as quickly as possible.
Are you talking about the stimulus? The stimulus
talking
money
about
from
the CARES
DARE?
package.
Okay. The with Revenue Tax?
Yeah, Revenue Tax. Also, there's many different
Department of
programs
Labor?
that labor, transportation, small businesses, to pay for payroll. To cover payroll, that is they would waive paying back some of the fees. So definitely, my office definitely is working towards getting that information out and getting the help that individuals and businesses may need.
right.
To apply
Hey,
for these things.
Senator, you got my number anytime, especially given that you're the oversight of revenue and taxation. Anytime you want to call and provide an update on any type of assistance or anything. Hey, you're no stranger, so just give us a call, shoot me a message, and we'll get you right on, right? Because a lot of people are asking about the stimulus checks, and people are hurting, man. So if you have any updates or anything to provide to us, shoot me a text, and we'll get you right on, okay?
Okay, appreciate that. Yeah, I just want to clarify about my colleagues that I think there is concern about the increasing the rise in cases, but I haven't. I am working with my colleagues to put a resolution together in regards to this. So, definitely need to kind of organize behind the scenes as well.
Right on, right on. Okay, thank you, Senator.
Thanks, Senator.
All right, thank you.
Be
Take care,
safe.
guys.
Wash your hands.
Likewise.
Okay, bye. There you go, Senator Sabina Perez, 821. Can we just kind of run through the numbers again from the Joint Information Center? Of course, 3 COVID-19 fatalities on the island of Guam in the latest testing numbers, Sabrina?
All right, as of 9:40 last night, the Department of Public Health, they tested 41 individuals for COVID-19. There are 6 that tested positive and 35 that tested negative, and that's through Public Health's lab. The overall count, this includes the 6 positive cases that were tested by Naval Health Research Center in San Diego. So the total number of confirmed cases on Guam is 77.
And
3 deaths and 7 fully recovered.
And then if you guys weren't listening early this morning, shame on you. Like we said, it's real information in real time, and we played a big chunk of a press conference from Acting Secretary of the Navy Thomas Modly? Or
Modly, yeah.
Modly.
Or could be Modly.
Right. And so he had actually put out some numbers. Apparently, we talked earlier about the military first put them out, then said they're not going to. And now I think because of this clamoring that's going on not only here on Guam, but in the national media, clamoring for information, the acting secretary did release numbers from the Theodore Roosevelt.
Right. 93 positive, 86 are now exhibiting symptoms. 593 have tested negative, with 1,273 tests that are still pending results.
Oh, there you go. And we're going to take a break. It's 8:22. It's the Containing COVID KUAM News Takeover of Guam's favorite, I-94. Good morning.
GU Self Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Today, the soldiers and airmen of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war. Please stay home. Saga Gigimatmizu.
Hafaday Marianas, this is Tomas Maglonia on the island of Saipan reminding you to stay home as much as possible. And when you have to leave your home for essential things, practice social distancing. Remember, you can still keep in touch with your loved ones online. We can get through this as one archipelago, one Marianas.
Miss our daddy, Specialist Joshua Manzanotnia. I can't wait for him to come home. Keep us safe and stay home. I miss my daddy, and I can't wait to see him. So keep us safe and stay home. Dab.
Hafaday Guam, this is Roki Martinez, local MMA fighter. I'm doing all my training at home, so man, I encourage you guys, please stay home. Let's help the community out. Let's help the hospitals, the doctors, the nurses, everybody on the front line. If we all stay home, it helps them out. And the sooner we can do this, the sooner we'll get done. So I encourage you guys, please be a team player for the community. We can all do this. We can all help each other. And man, let's get through this. We're a strong community. So again, I encourage you guys, please, please, please stay at home and stop the spread of the virus. Thank you.
Hafaday, I'm Jonagan Charfris, senior producer for KUAM News. And I'm sure you are probably tired of hearing it, but I'm going to say it one more time. I urge you to please, please stay home. To protect your parents, grandparents, manamko, loved ones, neighbors, hell, the entire island. Stay put, stay home. Make sure you wash your hands, practice social distancing. I know it's hard because we miss hanging out with family and friends, but the sooner we do our part, the quicker we'll get back to our regular routine. We will get through this. Thank you, stay safe, and stay home.
Hafaday everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together, this war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat, or Happy Birthday a couple of times, but make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers, and you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important. Nestor Lecanto for KUAM News.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafaday. Yesterday, I told you that Guam must prepare itself for more days of sadness. Unfortunately, one more of Guam's COVID-positive patients passed away at 11:58 this morning. He was 81 years old, admitted to Guam Memorial Hospital on March 26th, and suffered from multiple comorbidities, including diabetes, hypertension, coronary heart disease, and chronic obstructive lung disease. And while these moments have come too quickly, I ask you again to join me in a moment of silence, honoring this man's life, those he loved, and those he left behind.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Today, the soldiers and airmen of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war. Please stay home. Saga Gigimatmizu.
Hapaday everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together, this war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat or Happy Birthday a couple of times, but make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers, and you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important. Nestor Lecanto for KUAM News.
Containing COVID. I lost track of what day it is.
It's Thursday, April 2nd.
All right, week 3 of shelter-in-place orders and mandatory social isolation. Of course, the governor has shut down non-essential businesses. You know what we're kind of wondering?
Wait. It's also Corn-Free Day.
Yeah, it's Corn-Free
Day.
Quarantine Day. As our man in quarantine. We got to get a new man in quarantine now.
Yeah. Maybe I could hook up with somebody on the...
Yeah. Once you get a Tinder. You get a Tinder.
Why don't you?
For research purposes. No, but yeah, so what we're kind of wondering, and we're talking about this morning, and something that I think we may have to mentally prepare for is, are we going beyond April 13th? And it kind of looks like, the governor's not getting her 0 cases or her 1 positive case.
Which means that you guys are not following her directives.
I wonder if that's what it means. I don't want to put...
Or we're not testing.
I mean, you're right, though. A lot of people are not following the directives. Mm-hmm. And I don't know when I became a grumpy old man about this, but when I go around, it really makes me mad when I see just people out here. There was someone that sent me a picture of Bank of Guam and Agana. I know you guys saw this. It's going all over the island. And it was like they were just crammed together in line. And that's what I was, something I asked the governor in the press conference when she first extended the order. I said, hey, we got all these essential businesses that are open, and they're open for a limited amount of time. So you're getting like a traffic jam. We see it at the commissary with the Monomco and the retirees on the weekend, and we're seeing it at the banks. We're seeing it at the drive-thrus. You guys went to go get lunch at a drive-thru, and the line, circled 2.5? 1.5. A comedic exaggeration. 1.5 times around the building. Mm-hmm. So what I'm seeing is that with the order allowing for businesses to stay open, it's kind of making people think that they can just go out and do what they got to do, which you do. I mean, I know a lot of people are still working. Mm-hmm. So 8/31, that's what I was kind of wondering, is when are they going to announce an extension of these orders? We had
even the curfew.
Right. Yeah, so Saipan's got a curfew 7 p.m.
to 6 a.m.
to 6 a.m. Nobody move nobody get hurt.
And just real quickly, I just wanted to make sure I corrected myself that there are a total of 77 cases testing positive and 9 patients who have recovered. Earlier I said 7, but it is 9. Thank you, Jessica.
Thank you, Jessica.
Mengalta.
And also, we wanted to, and part of that release, the Joint Information Center, is that they have opened up a additional public health clinic where they are going to be conducting COVID-19 tests.
Evaluating patients and collect specimens if necessary. The Central Public Health Center is located on South Savannah, Barragata Drive. Phone number for more information is 638-4513, 638-4513.
All right, let's go up north to Jigo and get Mayor Rudy Matanani on the line here. A lot of mayors on the show this morning. They're right in the front lines. Mayor, good morning.
Morning, Chris.
Half a day, Mayor.
Half a day, Sabrina. You know, I know you're in the front line here, but can you just give me the opportunity to please thank the first people online, which is the doctors and the nurses. You know, I don't know if those people, you know, have nightmares when they wake up, but you know, just to put themselves on the line, you know, and then thinking about how are they going to disinfect themselves before they go in their houses.
Yeah.
And I heard Patty Arroyo on the radio saying how her kids, you know, make sure that she's safe, and before she goes in the house, she has to clean herself and then go straight to the shower and all that. You know, people don't realize how dangerous these things are. And again, I want to, you know, say kudos and thank you very much to the frontliners, which are the doctors and the nurses that face this thing straight on.
Yeah.
Mayor,
you also have Wayne is also on the front lines of this too, so this impacts you personally.
Yes. And you know, we seem to forget, and we show that we forget when we don't do our part. And Chris, I heard you saying, you know, about people staying home. You know, there was a guy here, and you know, it's kind of hard, you know, to figure what's right and wrong when you are faced with a predicament like this morning, when this guy said that he has artists to sell because he's got kids to feed and he doesn't have any work. You know, so I gave him a case of water and $10, and I say, man, go home and stay home, because a lot of these people don't realize what they're doing. They're putting a lot of people in danger and getting affected by this worldwide virus. And you know, it's sad, but you know, we need to move on. But you know, guys, can I just address the thing about that carrier that's out at sea? You know, it's very, very hard to make the right decisions, okay? But who is going to protect Guam when Russia or China starts attacking Guam? With that carrier out there, who do you think is going to protect Guam? And people have to think that those people that are in the carrier are a part of us. Or is it that they're just a part of us until we need their help? No. They are part of us for through good and bad. So let's not, you know, I don't know if you people, you know, listen to military people, and that's just going to make it harder on the Chamorros, you know, that are in the service, because I see this. I worked with the Air Force for 31 years, and they chastise our people. What do you think is going to happen when these military, you know, hear about us not, you know, almost not welcoming that carrier?
Almost not
and, you know,
welcoming.
The governor has a hard decision to make, but I hope, you know, that we do some compromising and not welcome these people, because these people are our front line. Hello?
Mayor, yeah, we're just letting you say your piece. Mayor, I just want to go back to your village of Jigo. Are the people of Jigo, are they staying home, Mayor?
Yes, the majority are, but you know, there's still a lot that's enough to create a problem that go around and, you know, pay less. They have couples just walking around and not knowing why they're there.
Just sightseeing?
Go ahead.
They're just sightseeing, Mayor? Is that what you're trying to say? Gallivanting?
And they don't realize that they're part of the people that can help. And how they can help is listen to the frontliners and the people that know what they're talking about and stay at home.
Mayor, do you have any COVID-19 positive patients in the village of Jigo? When we had first a couple weeks of batches, there was a rumor going around about Jigo having COVID positive. Have you heard anything about that?
Chris, I'm sure glad you brought that up. As far as I know, the last news that I heard about, that there's 33 that tested positive in the north. Nobody has come to me and told me if any of the villagers have tested positive, but I'm pretty sure that there is. And I don't know how they assessed what they should do in each village, but I can assure you that if the mayors know about these people, they can help a lot. Because, we don't know. I've never been called. And, they say that, the mayors are frontline, but this very, very important information has never been disseminated, and as far as I'm concerned, to none of the mayors.
You're right, because we talked to a lot of the mayors, and they all say they're not being told anything. Unless it's by the residents of the village.
Chris, we're not going to spread anything out, but let me tell you, we can do a lot of good and keep people away from those areas. But now, nobody knows. You know how we are tomorrow. Let me give you an example. Okay, one of your aunties or uncles you haven't seen, or a lot of family haven't seen, so they go over there and they visit them, and lo and behold, they find out that they're infected. Well, you just infected maybe 5 of the families that went over there that didn't know. These people should think about that. And you know what? Kudos to them. Because it is us that are looking in that know the things that they don't know because they forgot, because they've got too many things to think about. But let's get together, man, and help each other. Because that's the best way to fight this virus, is to work together.
But not work together, work together apart.
Work together. And I know that the leaders are trying, but there's still a lot of loopholes that haven't been covered, and they should, because it means a lot.
So nobody in the village has contacted you that is COVID positive?
No.
No one at all?
And I know that these people, that are on the front line that are making these decisions, I feel for them, okay? Because they have a lot on their minds, not to mention their own families. But we have to work together. When you hear people talking, try to diagnose what are the good and the bad, and if the good overweighs the bad, then I think that you should implement it.
Are you on the chat WhatsApp group that Mayor Hoffman and Mayor Luis Rivera are on with the EOC?
Yes, we are. I am.
Mm-hmm.
And, I try to chime in, and I try not to, I really don't, when I think that they should hear what I think, I just chime in, but I try not to get involved with that, because the less of us that get involved, I think that the better it is. Just as long as we understand what informations are going out there. Because, the communication is very, very important about these things that's going on.
Yeah, Mayor, Mayor Rudy, man, I'm kind of bothered that you were the mayor of one of the biggest villages and they're not communicating with you. And I'm more bothered that's the same thing that Mayor Hoffman is saying. It's the same thing that Mayor Rivera is saying. So Mayor Del Alvarez of Santa Rita, the same thing he's saying. Mayor Ernest Chargaloff.
Let me tell you something, Chris. I feel really, really bad. These people, man, and like I said, okay, they're all under pressure, and the least that we don't bother them, the better decisions and conscious decisions that they can make, because every decision that they make has to do with every single person on this island. And I try to do my part and just keep my mouth shut, and when I think I should speak, I speak. But the bottom line is we have to hold hands and defeat this virus, because this virus is not just in Guam, this is all over the world.
Mm-hmm. All right, Mayor.
Thank you, Mayor Rudy. It's always good to hear from you.
Thank you very much.
Do you still have Otis or what?
Pardon me?
Do you still have Otis or?
Well, I kinda put an X on the Otis for today.
Okay.
That guy don't realize it, man. I love Otis.
Right. Yeah.
But I told him, I said, son, what if you are infected? You're infecting a lot of people here in Jigo, and we cannot be doing that. You're probably infecting your family that you're trying to feed. You guys got to think, positive and think the right way and do the right thing that you need to do for your family and for the people around you.
Right. They should eat that Otis, because what we're seeing is people buying a lot of canned goods, and we're on this quarantine, people just running through all kinds of canned goods. You guys aren't eating your fruits and vegetables.
Yeah, I hope that guy is listening, that I gave money to can bring back the Otis and put it under the flag that's flying.
Okay, Mayor.
Hey, God bless all of you.
God bless you, Mayor.
And be safe.
You too, Mayor. Wash your hands, huh?
Always be safe. Always think about safety, because you guys are out there in the front line too, and this thing ain't messing around with us.
It's not, Mayor.
I hear you.
God bless all of you.
God bless Guam.
God bless Guam, and God bless Jigo.
All right, there you go. Mayor Rudy Matanani. Now I'm craving Otis. 8:45. Guam's favorite. It's containing COVID. The KUAM News takeover here. They're having another press conference briefing.
Daily briefing, 1 o'clock.
Yeah, and in case you didn't hear, they've also opened up a public health clinic in Barragata Heights. It's not the skilled nursing facility. This is another clinic.
Yeah.
I think you go up the commercial.
Next to the commercial tire depot, and drive to the top of the hill of the residential area until the road ends. So that's the Central Public Health Center. It's a large complex on the right side. And it's open Monday through Saturday, 8 a.m. to 6 p.m. The number is 638-4513. The number's on your screen if you're watching us on Facebook, 638-4513. It's a primary care facility. Barragata Heights nurses and doctors are available to evaluate patients and collect specimens if necessary.
Well, there you go.
South Sabana, Barragata Drive.
Okay, 8:45. We're going to take a break and do news. It's Thursday, the second day of April, containing COVID. Good morning, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Earlier this morning, I spoke to Admiral Minoni and Admiral Aquilino regarding the letter from Navy Captain Brett Grozier of the USS Theodore Roosevelt. Throughout our response to COVID-19, I promised each of you that I would undertake any action necessary to keep the people of Guam safe. For this reason, I have agreed to allow the restricted housing of sailors who have tested negative for COVID-19. In partnership with the Guam Hotel and Restaurant Association, public health officials, and representatives of the Navy, only sailors testing negative for COVID-19 will be housed in the vacant Guam hotel rooms, subject to a 14-day quarantine period enforceable under the Uniform Code of Military Justice. Because I did not make this decision lightly, other conditions must be met as well. There will be daily medical checkups of all sailors. Military security will be on every floor and at all points of entry. Individuals will be subject to quarantine protocols. Our beaches are off limits, and PPEs will be provided by the military to any hotel worker who is a part of this operation. We have an interest in protecting our community and stopping the spread of COVID-19 just as much as the military has an obligation to return the USS Roosevelt to the open ocean to protect Guam and the region. I know there will be a small chorus of cynics who will oppose this decision, but now is not the time for us versus them. While there are sailors on board that ship from every corner of the nation, some of those sailors call Guam home. They sat at King's with friends on a Friday night. They graduated from places like Simon Sanchez and George Washington. They are our nieces, our nephews, our sons, our daughters, and grandsons and granddaughters. And we can protect Guam while being humane to them. That is the Guam I know, and we will not abandon who we are out of fear. Every decision we make during this pandemic is made and will continue to be made with the health and safety of our people in mind. You entrusted me to lead this office for the good of our island, and as your governor, it is a responsibility I do not take lightly.
Thank you, Governor Leon Guerrero, for inviting me here today. First, I would like to thank you and your staff publicly for the leadership, collaboration, communication, and coordination that you've shown throughout this crisis. You know, when we first became aware of COVID-19 and its start and march across the globe, you immediately and your staff immediately contacted Joint Region Marianas to coordinate our efforts, and I truly do appreciate that. To the people of Guam, first off, I want to say thanks. Not only has your support been unwavering since all my years on Guam, but during this time of crisis, you have fully been behind the United States Navy, the Air Force, our partners in the Guam Guard, and the Army Reserves. We truly appreciate all your efforts. To the people within the fence lines on the military bases, I've asked a lot of you the last few weeks as we've worked to protect Guam, both inside and outside our bases, from the spread of COVID-19, as well as to support our shipmates and sailors on the USS Harry S. Truman, the USS Theodore Roosevelt, and the other ships in port. You've been asked to sacrifice, you've been asked to work long hours. I truly appreciate your efforts. There's no higher calling than taking care of our shipmates and families. To the folks that are outside the fence line, once again, thank you so much for your help. Thank you for your prayers. I really, truly appreciate the outpouring of support that we've seen for the sailors of the USS Theodore Roosevelt. Thank you.
The question is, the captain of the Teddy Roosevelt had recommended removal of all but 10% of the crew. Is that the plan at this particular point in time?
So the plan at this time is to remove as many people off the Teddy Roosevelt as we can, understanding that we have to leave a certain amount of folks on board to do normal watch standing duties to keep the ship running. That doesn't mean that all of those people will be brought out into hotels within the local community. It means that we'll work with the government of Guam, the Hotel Restaurant Association, and then within our fence lines to appropriately house all of those sailors within CDC guidelines.
And how many, Admiral, will there be at a time transported down to Tumon?
Yep. We're developing that plan right now, but it's going to be in manageable groups, and they'll be transported and controlled by military personnel only.
Admiral Aquilino had mentioned a Marine contingent of medical personnel. Can you elaborate on that?
So we will have approximately 40 professionals from the 3rd Marine Expeditionary Force Medical Battalion arriving on island within the next 24 to 48 hours. Those folks are not only here to help the sailors on Theodore Roosevelt, but also to help build capacity at Naval Hospital and then backstop capacity within Gov Guam.
What reassurances would you give to the people of Guam that transferring these sailors from Naval Base Guam to Tumon does not pose a threat to them?
So the biggest reassurance that I can give you is that all of these sailors that are transported off Naval Base Guam out of their quarantine
will be gone after this. So let me tell you about this girl, yeah, she's so fine. And every single day she's running through my mind. And I just wanna call her mine. Because your smile makes my day. And you take my pain away. Oh my darling, love me back. 'Cause I'm gone.
Kids from Chook.
No more trying.
Hey, good morning, Guam. Thanks, guys, watching on our Facebook live feed. Haven't heard from KFC in a minute. Hope you guys are doing okay and washing your hands. 8:54. Some people who are doing okay, quarantine-free day is we're releasing travelers and passengers who had been in quarantine for 14 days. And so Rebecca Respicio of the administration has been kind of the point handling that. And so we're going to bring her on here. Morning, Rebecca.
Hi, Rebecca.
Hey, hi, good morning.
Good morning.
So maybe you could just tell us what's on your plate this morning and what's been happening with moving people out of quarantine.
Yeah, absolutely. So basically this morning we are proud to say that we released 80 from the Pacific Star facility and then 44 from the second facility. And they were all happy to leave.
I can imagine.
They also, you know, it really was a turn around of attitude and feeling and just finally understanding the importance of these quarantine facilities. And so, they left with a smile. They received their clearances from public health that they finished their 14-day quarantine process. And everything went really smooth this morning. We began at 5 in the morning. Sending them home.
Are they their local residents that were on quarantine that were returning? Just
yeah,
okay.
For the most part, yeah. They're going home. They're happy.
Going home to some good old kadu
beef stew.
And their families, most importantly. Yeah.
And back into basically, you could say quarantine.
Yeah, it's like you're leaving.
Yeah, you know, we did. We left them and we asked them to please continue their practices with social distancing and also to, you know, don't forget to just wash your hands frequently. So the same messages, and we continue to ask them to, you know, just take care and be safe and just remember that they weren't here for a reason that is just going to, you know, basically if they don't continue their practices, then they just, you know, put themselves at risk. And why would they spend 14 days and go out and do that, right?
Yeah.
So
right.
They all walked away committed to staying safe and teaching some of the things that they learned in here to their family.
Hey, Rebecca, so last night we got a video from someone who was quarantined there at the Pacific Star, and they shot a video of some new passengers, arriving buses at the Pac Star. Can you tell us about that?
Yeah, so as you know, the governor's new order requires that all flights go through the 14-day mandatory quarantine. So we do get flights still from Honolulu and Narita on a nightly basis. We haven't been getting flights from anywhere else, but they are very few, and the planes aren't full anymore. You know, people are starting to take this very seriously, and they don't want to risk themselves in travel. But all of our guests, I'm happy to say that when they do arrive, they are fully aware of the process that has to take place, and we've had nobody angry, you know, unlike in the beginning. So I think the realities of how it's hitting Guam and what it's, you know, how it's affecting our island and our people are really humbling everybody, and they know that we're just in this together, and that it's a process that's necessary for the safety of everyone.
Hey, Rebecca, so when they first rolled out the quarantine procedures, I believe we saw an exception for people with significant ties to the community. Are we still allowing for that exception? Or
No, that was previously during when it was only the Philippine flights that were mandatory, and then all other flights they could self-quarantine at home. But now with the governor's order, it's all flights. All flights are mandatory, so it doesn't matter if they come from anywhere, it's going to be mandatory.
Wow. Yeah. Resident or non-resident, doesn't matter.
That's correct.
What about the flight crew? I know people have been asking about that. Are they subject to the quarantine?
You know, I have not. I mean, we haven't received any of the flight crew,
Okay, so
and yeah, I mean, I'm hearing the same thing from the passengers that the flight crew has told them on the flight that they were exempted from that. So I'm really not sure of how they're handling that. But I know we're not getting them, the flight crew. I don't know if they're quarantining in another hotel or whether or not they're just turning around. Yeah.
So how many people are we looking at that's going to be on corn free?
I'm sorry?
How many passengers?
She's trying to make that a thing, quarantine free. Yeah.
Quarantine free, I love that. I could tell them that when we release more tomorrow morning. But so again, we 80 left one facility and 44 left the second facility.
Okay, and so that's it for today, as far as you know. Okay.
Yeah, correct.
Okay.
And the three that tested positive, are they still there at
isolated? No, well, I don't think they're there. I think they're. Yeah, wait, are they there?
Well, that's what I'm trying to ask.
Sorry.
No, so I think you're fully aware that we do have an isolation facility. Yeah, so
the one at Days Inn.
Everybody here is safe, and you know, although I can't comment on anything medical because of confidentiality, I'm just happy that everybody here is starting to fully understand the importance of this process and just how keeping themselves safe. And it's very risky to travel now, so the whole world, the whole nation is in this together, and so Guam is not exempt from what's happening in the world, and they're just understanding that they can be safe. And although 14 days is hard, oh my gosh, it was hard, especially in the first week. But people have just had a 180, and you know, especially when Guam experienced the first death from this virus, people just changed. The guests that were here in our facility, they just really, it became so real, and the attitudes were changing, and the anger was disappearing, and they were fully, they started to be more cooperative. We had people that were just like, gosh, I'm kind of scared to go home now. I feel safe here. And although they wanted to go home, they missed their pets and their family and their children. But they realized the importance of this process.
Hey, Rebecca, are you involved at all with the process of moving the sailors down to Tumon quarantine?
So the only involvement that I had was just to share our best practices, because, I mean, nobody's an expert at this. But because the government's been doing it already for a full 2 weeks, it doesn't make us an expert, but I was able to share with some of the military personnel that are going to be overseeing the same processes that we are doing. So we definitely are collaborating, and we are helping to, share what's working with our quarantines, and just kind of help them, get a step in the right direction, I guess you could say.
Right. So, Rebecca, the way it looks in your conversations with these military people who are going to be overseeing the quarantine, is it basically going to be self-contained in terms of, minus the hotel staff? It's going to be the military. Are they going to be just policing their own? Or they're providing their own security? Are we using any local resources? Do you know?
No, I don't have the 100% details on the back side of it, just that I was asked to just share whatever I've learned so far in our processing, and just what's going to make it easier for those that are quarantined. As for the details on where the resources are going to come from, I'm not aware of the details on that.
There was something Admiral Manoni mentioned during the press briefing at Adelup yesterday, and the question was asked by one of the reporters, how many to a room, and he said they're looking at two. Is that something, I guess, based on your experience?
Well, for here, how we do it is, like, obviously, some people would feel like if they're going to be quarantined, they would be individually, but for here because we have families that travel together. They've been rooming together. They arrive together, so they fly together. They arrive together. So when they do arrive, we do consider them a family, and they actually are okay to stay in one room. And we also do offer, especially if it's a larger family, we definitely don't go over the max that a hotel room would hold, and we do offer them separate rooms. You know, I mean, it's safer, but also the family has been tied, and they have been traveling together. So they come here together. They would have gone home together, but again, who's to say that they would have stayed home together? So, you know, that's how we handle it here. If they do prefer a separate room for whatever reason, they would share. Either they have other medical, or some people came back from the Philippines from medical procedures.
Exactly. Yeah.
So they kind of do need that space in order for them to heal at the same time that they are being quarantined. And we respect that. And again, our priority is really just the health and safety of everybody in here, while also recognizing that they are contributing to the health and safety of the public outside of the quarantine facilities.
All right, thanks, Rebecca. Rebecca, what's you're the quarantine coordinator? What?
Gosh, let's just
just make something up.
Call me whatever you want as long as it's nice. No, just kidding. So yeah, basically, I've been tasked to oversee the operations of the quarantine facilities. Okay. So I'm gonna ask the chief of staff what's my official title.
Right.
Title.
You find out if it comes with a little bump in pay.
Honestly, no.
Okay.
It's never about. Honestly, I mean, at first it felt honestly a little overwhelming because nobody really knew what had to be done.
Yeah. Right.
But we just knew that we were in it together, and the most important part is I always remember that the safety of those that come in here definitely equal to the safety of those out there, and that's our mission, and that's the most important thing, and everybody's on board. I mean, it's hard, 14 days, you know, especially after you travel, then you have to come, so we welcome them, and we say, you know, you now have an extended staycation, and how, you know, I mean, it's beautiful here, so they have their balconies, and the hotel management has just been excellent and really accommodating and trying to do the best, so it's been an experience, but it's all worth it. That's all I'm going to say. It's really worth it.
You definitely won for the books, Rebecca.
Yeah.
Okay.
Well, thank you so much for what you're
and
doing.
thank you for what you guys are doing, too.
Thank you, and
Thanks.
wash your hands, okay?
Always.
Okay.
Stay safe.
Thank you, guys. Okay, you too.
Okay,
All right.
bye.
She's kind of running the quarantine end for the government of Guam, Rebecca Respicio. 905 or KUAM-FM. Hagatnya, it's containing COVID, the KUAM News takeover of Guam's favorite Good Morning.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Hapaday Guam. My name is JJ Ambrose. That's Juliet. This is Isabella. And that's Applejack. For the last 2 weeks, pretty much since she was born, we've been stuck at home in quarantine. I miss my friends, I miss family, I miss going to the beach, and I definitely miss going to school athletics. But the silver lining is I get to spend more time with them. We've been catching up on homework, working out, and I've been changing a whole lot of diapers. But I know there's an end to this. We've been doing our part. We're asking you to do the same thing. Stay home.
Miss our daddy, Specialist Joshua Mancinotnia. I can't wait for him to come home. Keep us safe and stay home. I miss my daddy, and I can't wait to see him. So keep us safe and stay home. Dab.
Hapaday everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together. this war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat or Happy Birthday a couple of times, but make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers, and you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important. Nestor Lecanto for KUAM News.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home.
Quickly want to get Public Health Director Linda DeNorsi on the line to talk about the clinic. Linda, so we saw this in the JIC. This is a public health. Is this a
Central Primary Care Facility?
Can you tell us a little bit more about this, Linda?
Yes, it's another facility in the central part of the island. As you know, we have the Northern Region Camille Center, and then we have the Southern Region Camille Center in Rohan. The Northern is in Dededo, everybody knows that. And this is the central facility that just opened just because of the COVID. It's just a temporary facility for now.
Okay, and so who can come? They can come in there, or they just call?
Well, it's better to call first, and they can come in and see our nurses, and our nurses will screen them and get all the information that's necessary, just like they're coming in for any complaints or any symptoms. And if they are examined by our nurses, then they'll determine whether or not they need a nasopharyngeal swab. And if a swab is needed, then the nurse will do that.
Linda, so we're accepting patients at this central public health clinic, and these are patients with any type of ailments or health issues?
Well, pretty much they can just be examined with any health issues, and then we will figure out where they're going to go as far as if they need to see a physician, and then we can refer them to the appropriate, whether northern or southern.
And is this for the uninsured or people? What kind of coverage do they have to avail of this?
Anyone, whether they have insurance coverage or not, northern, any type of patients, even those that are uninsured, Medicaid, MIP, privately insured.
And is this was this clinic stood up because of was there an increase in people at maybe the northern and the southern clinic, and so you guys kind of needed to open this up?
Mm-hmm.
No, we just wanted to make sure that there was a clinic at each region of the island. That was all. Just because of there may be transportation issues, that we want to make sure that all regions off the entire island is covered.
That's thoughtful of you. Linda, I know we asked about the clinic, but I just real quick, if you could, any update on the disaster declaration assistance that's supposed to be available?
Yeah, you asked me about the SNAP, right? Yeah. For now, the SNAP just got approved today. Fortunate that you called me. Yes, we just got the approval, but it's only for the emergency allotment. These are only for SNAP benefit recipients that are already on the program, and that they'll get the maximum allotment amount. For those SNAP benefits that already received the maximum allotment, it will not apply to them.
Mm-hmm. And then what about the, so just to be clear, there is going to be a program for people who don't normally qualify for food stamps, right? Because of the disaster declaration that was granted by President Trump?
On this one, no. This is that is not yet determined. The one I'm talking about is the ones that are already SNAP recipients. It's called an emergency allotment.
Right.
I don't have any answer in that regards yet, but for now, all I know for now is that the SNAP recipients that are already on the program will have a maximum allotment given to them now.
Have you guys seen an increase in people applying for the food stamps over the last week?
Right now, our staff are just busy with doing all this. If they are applying, they're doing it through telephone,
right, or email.
And yes, we have gotten several applicants. I think about a couple hundreds that came in through phone interviews. And they are applying, and yes, we're also evaluating whether they're qualified or not. That is an ongoing through telephone, and if they need anything dropped, it's just going to be dropped. We don't have a face-to-face visit at this point in time.
Okay. I know you're busy.
Yeah, I know you're busy, but just going back to, again, there is going to be, though, an emergency assistance with the food stamps because of the disaster declaration, but, can you just, what do you have on that?
I don't have anything on that yet with the Food Nutrition Services, but we'll get back to you as soon as we hear anything.
Okay.
Is that fair enough?
That's so fair, Linda. Appreciate it. Thank you so
Linda.
much for your time.
Okay.
Okay.
Take
care.
Bye-bye. Bye. Okay. Linda DeNorsi from the Department of Public Health and Social Services.
She was limited for time, so she just wanted to make sure, we wanted to make sure she gave us a little bit more information about the Central Primary Care Facility in Barrigada Heights. So it is now open. There are nurses and doctors that will be available to evaluate patients and collect specimens if necessary. It is located on South Savannah Barrigada Drive. To get to the center, the community is advised to take the south entrance to Barrigada Heights next to the commercial tire depot and drive to the top of the hill of the residential area until the road ends. The Central Public Health Center is the large complex. It's on the right side. It operates Monday through Saturday from 8 o'clock in the morning to 6 o'clock at night. You are advised to call first. That number is 638-4513. So they opened this facility today. They still have the community, the health centers in Arahan, and they still have the one in Terero. So they opened this one in the central part of Guam to handle residents in the central part of the island. So again, that Central Primary Care Facility is now open in Barrigada Heights. Call first at 638-5 4513.
All right, and that's cool. That's a little proactive. Linda saying that they wanted to, accommodate and come out ahead of the curve in terms of giving people another avenue, whether you're sick, any type of ailment, and they're going to be doing the screening, and also the testing will be available if they make a determination that you need to be tested.
Right. And there was something else she said. The emergency SNAP, it was approved.
For SNAP recipients, people who are already on the SNAP program. And she also said that there's no word yet, no timeline yet on emergency food stamps for those who have been displaced or otherwise impacted by COVID-19. We know the governor had said apply for food stamps. I wasn't sure if she meant apply for the regular food stamps. Because, people who have just been laid off or had their hours cut, sadly, they might not even qualify for regular food stamps. But with the disaster declaration that President Trump approved, there's a lot of disaster assistance tied into that. And so Linda said that she's going to keep us posted.
Yeah.
And we're going to keep you guys posted because that's been a big part of the conversation this week is people are hurting. People are hurting.
And for those of you who have questions about that, you should just call 311.
Right, and they've actually done a couple things with the 311 number where there's a press 1 to do this, and press 2 to do that.
Yeah, it'll direct you to whoever it is or whatever the issue is that you want an answer to. Let me see if I can find that.
Right. Let's go 918 over to the University of Guam. We have Sierra Cruz. She's from the ISA Psychological Services at the University of Guam, assisting women victims of abuse. Good morning, Sierra.
Good morning, Chris and Sabrina.
Hi.
So we just wanted to, this is something that, I kind of thought about when we get the magistrates, unfortunately, even with this, it's really tragic with everything that's going on with COVID-19, a shelter in place. There are still instances of domestic violence that we're seeing. And these are the ones where, people are getting charged and the police are getting involved. But in talking to some of the stakeholders in these different movements here, it seems like there's a lot of things happening that aren't necessarily getting reported to police. So that's why I felt it was important to kind of fold you guys in the conversation and share with our audience what services are available through your program.
Yes, thank you so much for including us in this discussion. So we know during this time, a lot of people are in their homes because that's where it's safe. But for victims of domestic violence, their home is the most dangerous place for them. So it's very self-isolating, and we know how hard it is for victims to even have access to their phone, especially if the abuser is at home as well and doesn't go to work. So usually with victims, they wait for their abusers to go to work. They secretly reach out to friends, but during this time, we know it's very hard to be away from them. So we wanted to make sure that victims know we are here and available for them over the phone and through video sessions. So the University of Guam is continuing to provide services through phone and Zoom, and I will give you our information so that you can call us for any reason. So we see victims, but we also see people who just need help during this time.
What's the number?
So our phone number is 735-2883.
Okay,
and our email is isa@triton.uog.edu.
And what kind of calls are you guys getting?
So we usually, when we talk to victims, it's when they already reported or they have already sought help from law enforcement or they have been in the shelter already. So that's pretty much the clients we see, but everything is confidential here, so we won't share any details, but we just pretty much just talk to victims that have trauma and difficulty experiencing moving on from the abuse, and if they need safety planning, then we refer them to our program partners from Vero and the Guam Police Department.
Have you been seeing an increase in phone calls?
No, not an increase, but we have been hearing from a lot of victims who we were already seeing and talking about, like friends or other people experiencing the same thing.
Right, and in talking with Speaker Judy, I called her up the other day. She was telling me, and she was Vero, that what they're getting, and this is just so. I had the hardest time wrapping my mind around it. My mother was a victim of abuse, so it's very close to home for me. Is they're getting calls at Vero where women are calling in and then they're abruptly hanging up, and she said that that means that the abuser is there in the house, and so. They have measures at Vero where if anybody calls back, they don't say who they are or where they're at. So I thought that was really telling, and that's why we kind of wanted to give the opportunity and really recognize you guys, because there's just so much going on, and looking at everything that we're dealing with, it's so easy to forget that there's sections of our society, whether they be homeless or victims of abuse, that. There are people like you guys and your group that are, making sure that those people don't fall through the cracks.
Yes, and our services are completely free. I know it's hard for victims to reach out right now, but we also want to encourage family members and friends, because I know it's sometimes you see signs with friends and people that that might be in these types of relationships. So that's a good way to reach out to them, instead of just waiting for them to reach out to you.
Have you ever had to call the police? Have you ever had to call the police on behalf of anybody that's called in?
We do safety planning with victims to, if they are feeling that they are at risk, we don't force them to call the police. So if they want to, we could, but for some instances, sometimes if they call the police, they might be at further risk, and we know that it could happen if they're trying to seek services, especially now.
And there's just so much increased stress all around. This is something else when I was talking with Speaker Judy, is that everybody is on edge. That's not any kind of justification, but it creates the propensity for these incidences to occur, which it's can't even.
Yeah, during this time, a lot of people are out of work and very stressed out with finances, so that can cause a lot of tension in the home and lead to domestic violence situations as well. That's really right.
Right. Sierra, is there anything you wanted to add in closing? I know you're busy. We don't want to take up any more of your time,
No, that's it. I just want to say thank you again for having us on, and if any person wants to call us, just call us any time of the day. We are here Monday through Friday, 8 o'clock in the morning to 8 at night, and we also can talk to you outside of our hours of operation as well.
Okay. Well, thanks, Sarah.
Thank you so much.
Okay, good luck. Wash your hands.
Okay, you too.
Okay, bye.
Bye. That number is 735-2883.
Right. Pretty sad stuff. Talking with Speaker Judy. She's going to call in tomorrow or something. I just wanted to give recognition to these groups like Vero, like ESA Psychological Services, and social workers. They're really dealing with a lot of things that
mental health professionals.
Right. We're kind of just trying to cover this whole COVID-19 response, and doing that, we're starting to see out on the edge that there's other things going on that we want to share with you guys.
Right.
I want to do those Roosevelt. Let's go back to the Roosevelt now. In case you weren't listening this morning, very early we played a press conference, a clip from the acting secretary of the Navy, Thomas Modly. Bree's got some numbers from the USS Theodore Roosevelt.
Right, during a press conference with the acting secretary of the Navy, Thomas Modly, at the Pentagon, he announced that almost 1,000 sailors are already ashore, and at least 2,700 sailors, more than half of the crew, will be taken off the ship within the next couple of days. And in addition to taking steps to remove those sailors, they're also testing the entire crew for the virus. The Navy has tested 1,273 sailors. That's roughly 1/4 of the crew aboard the aircraft carrier. And so far, only 93 have tested positive. He did say that 86 of them are starting to exhibit signs and symptoms of COVID-19. 593 have tested negative. for the results here on Guam. As of 9:40 last night, 41 individuals were tested for COVID-19. 6 tested positive through public health and 35 tested negative. The overall count, which includes 6 positive cases that were tested by the Naval Health Research Center in San Diego, stands at 77. 9 patients have recovered, and there have been 3 deaths on Guam. As for the CNMI, this was announced yesterday that they had submitted 31 specimens for COVID-19 testing to public health here on Guam. Of those 31 specimens, 19 have actually been processed, resulting in 6 positive cases and 13 negative cases. The Commonwealth Health Corporation is still waiting for the results of 12 specimens. The 4 new cases in the CNMI include the 70-year-old male that passed away on March 30th, and that was when they held the press conference in the CNMI, as well as 3 females, ages 14, 60, and 77 years old. Some of these cases have come in contact with those who have a travel history from a location with confirmed COVID-19 cases. Other cases have had no travel history or no evident indication of coming in contact with someone who is positive for COVID-19. Again, this is what's happening in the CNMI. This new finding of cases occurring among those without close contact is suggestive that COVID-19 community transmission is occurring on Saipan. And also, United Airlines, April 6th through the 30th, they are going to be suspending flights coming into and out of Guam. So that starts, I believe that's Monday, April 6th. That's a lot. Across the country, we have an update. Let me just find that. The White House Coronavirus Task Force is now warning the worst is yet to come in the fight against the pandemic. And this is the words of our president. This could be a hell of a bad 2 weeks. That was President Trump. He says extending social distancing guidelines for the next 30 days is a matter of life and death. But even with the restrictions in place, modeling shows 100 to 200,000 people could still die in the United States. Dr. Anthony Fauci saying we don't accept that number, that's what's going to be. We're going to do everything we can to get it even significantly below that. One possible new measure that could be asking Americans to wear masks once the supply increases. And while most states have issued a stay-at-home order, there's still no plan for a national mandate.
All right, 9:30. We get a lot of comments about the situation with the public schools, and we're going to bring our education reporter Adriana Cotero onto the show. Good morning, Adriana.
Good morning, guys.
Hi. We miss you.
I know, I miss you guys. I listen, I'm like, I could be right there.
Yeah, long time no see.
I know, a very long time. But yeah, so I know a lot of people have been asking about schools, and we recently just talked to Deputy Superintendent Joe Sanchez, who's been kind of spearheading as far as making a plan in place if school does close. Now, it hasn't been determined yet that they will be closing. They said that as of right now, it's still under review and they're still considering it. But the closure is until April 13th, of course. And they shared their proposal recently this week with the parent-teacher organization should the closure extend past the April 13th.
And I think that's what kind of generated a lot of discussion is that people know that they've entertained the idea of these plans, what they're going to do. Situation A, situation B, or whatever. So that I think that's what's leading to a lot of people asking about it is that, and I saw John Fernandez, something he put on Twitter was like, we're making plans. We haven't, implemented them, but we are making plans. So can you tell us a little bit more about those plans?
Yeah, so the plan that they just recently announced that was to the PTO was that for kindergarten to 8th grade, their existing third quarter grades would stand for the year. So if they decide to end school early, then whatever grade they have for their third quarter grade, that's their grade. And then for high school, I guess it's a little different because you have AP classes, honors classes, and a lot of times they have those different credits, and I guess they also have service learning hours that they would have to also get a request by Guam leaders to have that requirement waived. So for high schoolers, it's also the third quarter grade that will stand for the semester. But if a student's failing a class, then they would basically give them the benefit of the doubt and let them have like a blanket 60%. So they receive the credit at the very least for that particular class.
60% of, what is that? Is it a D? Is that a...
Yeah.
60% got me a whooping. That's what 60% is.
From when I remember, I had a few 60%, but they were passing.
Yeah, 60% was like, you better trash that report card. Don't come home with it.
But so they received the credit still because they could have been failing the class. But, you know, it does also draw the question because they still had a couple months. So sometimes you think, you know, a final exam could bring that grade up even higher if you really, really studied. So, I mean, we'll see what they actually end up deciding on, but that is their plan in place right now. And then for students who are taking AP classes or honors classes, they get an additional 10%. Because with those classes, whatever grade they get in, it's usually a 10% is added because it's an honors class.
Adriana, knowing all the information and being in constant contact with officials in the Guam Department of Education, how close would you say they are to making a decision on pulling the plug on the rest of the school year?
See, I even asked that question. I asked Deputy Superintendent Sanchez if we would be hearing something within these next few weeks or where they're leaning towards. He said it was tough to say, but he did say, and I know that we know that other schools are doing the exact same thing already. So we know that the CNMI has already done that. We know many schools in the mainland have been doing that as well. So if we're kind of following suit with that, then it seems that it could be, but I don't want to say it yet because, school, we don't know, but I think that there may be a decision before the April 13th deadline, considering that they're already throwing these proposals out and also talking to Guam leaders.
Okay. Yeah, I noticed that it would be cool to have the superintendent actually be in one of these press briefings that the governor has, so that people, because that is like one of the number one questions, aside from the federal assistance and what are people going to do in the interim before the federal assistance kicks in. Well, we constantly get that. What's happening with schools? So I really appreciate you continuing to stay on top of what's happening within GDOE, and that's just GDOE. There are also private schools where we need to get updates from. But hopefully this will be taken into consideration when they have their press briefings going forward. But in the meantime, your interview with the deputy superintendent, I believe it's up now on our Facebook page. So we encourage people that are listening on the radio or watching this live stream to go onto our Facebook page and click it, and you'll get the latest information. Because that interview, I think you just did that interview this week.
Yep,
so,
just a couple days ago. And also, they launched the distance learning website, which I know you guys have mentioned on the radio as well. But just so people know that those lesson plans, they're not graded. So Deputy Superintendent Sanchez had mentioned that too, that even though they are going to be providing weekly lessons from educators, as of right now, they are not going to be graded, and they're not part of any grading for the school year.
So they're chalking it up to enrichment, right? Is how they're putting it.
Exactly. Keep kids occupied and continue learning.
But hey, if you parents want to, put a little pressure on the kids and tell them it is graded, no one's going to sue you for that. Adriana, what can you tell us about Grab and Go? I know we had the soup on a couple days ago. Are they looking at increasing the number of meals? We had a call from a guy who had went to pick up a meal. They'd run out,
Yeah.
They ran out. Yeah. So the last I heard, they were at 12,000 meals a day, and before their goal was 15,000. So quite possibly they could have reached that number then if they ran out, but they still have the 11 sites, and they have also added breakfast into their Grab and Go meals. So, and it's still at the same time you pick it up. So it's from 11 to 1, and you get breakfast and lunch at the same time.
All right.
And I know that Superintendent had mentioned that he wanted to get more locations and do it more inside the villages. So that was something they were going to work on, especially if there's a prolonged closure to the end of the year. I'm hoping to get him today to get some further updates and an interview. I had already messaged him, so we'll see if I can get him and get further updates. But their goal was 15,000.
Right.
They were, if early on they were already reaching 12,000, then yeah, they might have surpassed it. And these aren't just for these aren't just for public school students; they're for all students on the island.
Right. Any child, regardless of public or private or homeschool or whatever, is go and eat.
Exactly. So I think whenever they were also, when they designated that 15,000 number, they were probably looking at their public schools and taking averages from their lunches.
Right.
So now that there's all students across the island coming, then I'm sure there is a high likely chance that they are going to have more than 15,000.
Right. I'm waiting for the governor to declare the Guam DOE staff and all the volunteers helping out. It's an interagency effort. Would really like to see them be declared heroes because they are out there and they're just, this service is...
Oh, the nurses, the school nurses out there too on the front line.
Right. So, GDOE, you're right, Bria. It's interesting that they don't fold the Superintendent John Fernandez into the mix because the schools are a huge part of what's going on.
All right.
Okay, Adriana.
Well, thanks, Adriana.
Thank you so much.
You guys.
Wash your hands.
Stay home.
Yeah.
Bye, guys. I'm listening in.
Thanks.
All right.
Okay.
Take care.
Hey, great job, Adriana Cotero. Let's go right over to Nestor Lecanto, who's been following this situation with the Theodore Roosevelt, really before it even became a situation on Guam. Ness, you were so ahead of the curve. I just want to, pat you on the back. Great job. Great reporting on this issue.
Oh, thanks, Chris. Good morning, Chris.
Good morning.
Good morning, everyone. There was a press conference, a briefing earlier this morning, Guam time, with the Secretary of the Navy, Thomas Modley, the Chief of Naval Operations, that's Admiral Michael Gilday. A lot of information came out of that. We understand now from the Chief of Naval Operations, Admiral Gilday, that they've already moved about 1,000 sailors off the ship, and that, according to him, as of that time that he was speaking, which is about 3:30 this morning, they had already begun moving sailors off the base to the hotels. We're waiting for confirmation on that from Joint Region Marianas. Haven't received any word from them yet, but according to the Chief of Naval Operations, that movement has already begun. Let's see.
Yeah, so that's what you got. You interpreted it as though those 1,000 were moved off the ship and starting to move into the hotels.
That's what
okay. Yeah, which is interesting because if only 593 tested negative, and the 1,200 were still pending results, I would hope that it's only the 593 that tested negative.
Yeah, well, this is his quote. He said, I think you mentioned, Mr. Secretary, that we have over 1,000 off the ship right now. We'll have nearly triple that number of beds and spaces available by Friday, tomorrow, and we'll be expediting. People are moving off the ship as we're briefing right now. And in terms of the operational schedule, in terms of testing, we continue to get more efficient. Over the past 3 days, we've gone from 300 tests a day, I'm assuming, up to 500 tests.
Mm-hmm. Now, let me ask you something that we're seeing in the comments. So, we had Senator Sabina Perez on the line, and she talked about the massive logistical capabilities of the military and the Navy, and we're seeing in that they've been able to test already 1,200 sailors. And so just seeing in the comments, a lot of people imploring the Gov to make some kind of ask to the military for, some kind of assistance, whether it be with testing. How realistic do you think that is, Ness? Or do you know if that is something that's already, talks have already begun on?
I know that the Admiral Minoni said yesterday that there's a 40-member team coming from the Marine, 3rd Marine Medical Division I believe they're from Okinawa, and they should have arrived already because the Navy Surgeon General during that press conference that I mentioned also said that that team was supposed to be here, and he also announced that, and here's his quote, he says, "I'm happy to report that the Naval Hospital Guam, due to a lot of hard work by a lot of people, we were able to accelerate the diagnostic testing at the Naval Hospital Guam, and that is actually live now as I speak," and that was, like I said, 3:30 this morning.
So the Naval Hospital apparently is
testing
capable now of diagnostic testing.
Oh.
Wow,
So-
that's really interesting. And man,
So it's no longer a need to send it to San Diego. You can test it here
Yeah,
and
I'm
get
not
the
sure
results.
how that-
Mhm.
Yeah, I'm not sure what he meant by that exactly. If it can be all confirmed here, or if it still needs to go to
San Diego.
the Naval Research. I don't know exactly.
NRC something in San Diego.
San Diego.
Yeah.
Just say Navy San Diego.
Right. I wonder, Ness, if that's going to change. We had Linda on a couple days ago talking about the reporting requirements in the Naval Hospital is a community partner hospital, and she seemed to imply that cases that are tested through Naval Hospital, whether or not the sample is taken there and then sent off to San Diego, that according to the law, that those were the types of results that the military is obligated to report to public health. So I wonder if that's going to kind of change with the numbers that we're seeing, because
I certainly hope so, because the Secretary of the Navy during these press conferences has been very transparent with the numbers. In fact, we can quote from his statements this morning that, as Bree mentioned, there have been 93 positive tests. Of those, 86 are exhibiting symptoms and 7 without symptoms. There were 593 negative tests, and they've tested about 24% of the crew, and they've got, which is about 1,273 crew members out of, they confirmed the number of crew members was 4,865. So, they're a quarter of the way through, and they've accelerated testing. So I imagine that they'll get through most of them, fairly soon.
All right, so I guess I hope Manoni will be at the press conference again today.
Yeah, and that's how surprised were you to see Admiral Manoni at that press conference?
Yeah, I mean that was very good. For the governor's office to be able to have brought him on board, and he was very open to questions yesterday. So yeah, I hope that the admiral is back at the regular press briefing at 1:00 today.
Okay, well, we know that he's going to be briefing. We heard this from a couple senators that there is going to be a Zoom briefing with Admiral Manoni and members of the Guam legislature. I believe that's happening at 2 p.m., Nestor.
Okay, so are we getting the Zoom link from them, or?
I don't know. I'm going to put in maybe I'll put something in the speakers chat. I don't know how much they're liking KUAM lately, but we could try.
All right.
Thank you,
All
Nestor.
right, thanks, Ness.
All right, guys.
Okay.
See you in there.
All right.
You too.
9:44. So yeah, there's another press conference going down live as we speak. And
our meeting, you mean?
yeah, no, he said something. Was there a press conference?
No, the 1:00 daily briefing. That
Right.
what the information that he was letting us know about was from the press conference that happened at 3:30 in the morning.
Early this morning.
Yeah.
Right. Yeah. And I think we did we put that out on our Facebook or
The link to the press conference? I'm not sure. Jason's sitting over there. He thinks so.
Well, if he didn't, it's going to be.
Yeah.
Okay.
And we actually ran a lot of that this morning, where the Secretary of the Navy was providing the latest update and the chronology of how this all happened.
Right. And so, we had Sierra Cruz from ESA Psychological Services. Again, if you're just joining us, anybody in need of any type of services, whether you're a victim of abuse who's already had your case lodged, or maybe you even just need someone to talk to. It kind of seemed like that was also an option. What's that number again?
That
Bree?
number is 735-2883. 735-2883.
Okay, we're going to take a break and come back and close out the show. It's Containing COVID, Guam's favorite KUAM News. Good morning.
CBS Primetime Tonight kicks off.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Hafa Marianas, this is Tomas Maglonia on the island of Saipan, reminding you to stay home as much as possible. And when you have to leave your home for essential things, practice social distancing. Remember, you can still keep in touch with your loved ones online. We can get through this as one archipelago, one Marianas.
Half a day. Yesterday, I told you that Guam must prepare itself for more days of sadness. Unfortunately, one more of Guam's COVID positive patients passed away at 11:58 this morning. He was 81 years old, admitted to Guam Memorial Hospital on March 26th, and suffered from multiple comorbidities, including diabetes, hypertension, coronary heart disease, and chronic obstructive lung disease. And while these moments have come too quickly, I ask you again to join me in a moment of silence, honoring this man's life, those he loved, and those he left behind.
Alpha Day Guam, this is Rocky Martinez, local MMA fighter. I'm doing all my training at home, so man, I encourage you guys, please stay home. Let's help the community out. Let's help the hospitals, the doctors, the nurses, everybody on the front line. If we all stay home, it helps them out. And the sooner we can do this, the sooner we'll get done. So I encourage you guys, please be a team player for the community. We can all do this. We can all help each other. And man, let's get through this. We're a strong community. So again, I encourage you guys, please, please, please stay at home and stop the spread of the virus. Thank you.
Today, the soldiers and airmen of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war. Please stay home. Saga Gigimatmizu.
I'm Sabrina Sauce-Mazzanotti.
And I'm Chris Barnett. Join us bright and early weekday mornings on I-94 for...
Wanted to talk about our living room live local Fridays. It's going down.
It's going down this Friday. Yeah. Yes, we have our live local Fridays living room edition. We've got local artists that you've helped compile.
Yeah, so want to shout it out. Some of the artists that you're going to see, and this is something I believe we're going to do
Friday night, 6:30 p.m.
Yeah.
KUMTVA.
Right, but I'm thinking that this would be good to do every Friday. Did I just get myself into?
We can try if we can get a
that's not a commitment.
Yeah,
okay.
If we can get these local artists to share their talent with us.
And it was so easy. I mean, all I did was just throw out a message to a bunch of them, and the response was like, "Dude, you got it yesterday. Like, no problem."
And we actually have been playing a lot of their music. They've been sending it in. We've been posting it on our Facebook live stream. But yeah, and I got a chance to listen to some of them as we were putting the show together, and wow.
Yeah, you guys are in for a treat. So we got some tracks from, of course, my buddy Candyman, Eric Borja, and then Geff Potgu is going to jam
The Dolls.
The Dolls,
Oh,
yeah, we got the
they are
Dolls.
really good.
Yeah.
And of course, Microchild.
Right, Microchild. We've also got Ty and Teo,
Joe Garrido.
Yeah, so obviously we're very excited about this.
Yeah. And really the show is just to, I guess, show our appreciation to the first responders, to the doctors, the nurses.
And to the musicians, too, because they were kind of the ones who were first hit by this, maybe, with the closure of the restaurants and the bars.
Hotels.
Because, you know, so many of them make their bread and butter by playing for people. And the gigs, I mean, it was the first thing to go. And so I know part of what we're seeing with them sharing so many of the performances, and part of it is therapy, both for the audience out there, people who are kind of just stuck at home, as you should be, staying home, but also for the artists. You know, a lot of these guys, they need to like play their music for people.
And it's an outlet for them as well, right?
Right.
And for those of you who are watching at home and you start moving and grooving,
take some videos and send it to us.
Tag KUM News.
All right. So, yeah, that's happening. What did you give the details on that?
Yeah, it's at 6:30 p.m. on KUAM TV 8. You can watch it there.
Okay, and
this Friday.
We're going to leave you with a new track from Annette and Geff Poggle. Again, this has been a Containing COVID, the KUAM News takeover of Guam's favorite. What we're doing for you guys today, of course, going to get more info about testing, where we're at with testing, and the governor's got a press briefing happening at 1 o'clock. And, you know, really praying for some type of positivity. You know, the last couple deaths, I mean, not saying that we need to get a heads up on it, but, you know, we're going into these press conferences cold, and announcements have hit very hard as they've led a couple of these press conferences now with news that, you know, 3 of our beloved Manamco have succumbed to this deadly virus called COVID-19.
So please, everybody, listen to the mandate for social distancing and social isolation. Stay home. Don't go outside if you don't need to, or don't leave your house if you don't need to.
Right, you're saying it wrong. You're supposed to say stay home.
Bye.
Okay, here's Annette and Geff Poggle for Sabrina, Guasi, Chris, adios.